Hello everyone, good morning. Am I visible, audible? Good morning Aditi, good morning everyone. So let everyone join, we will wait for 1 minute. Let all the students join, we will start the session. Okay? Meanwhile, you can give the confirmation if I'm clearly visible, audible, and you can see my slides also. Everything is good to go. Everything is damn clear. Okay? Everything is clear? Thank you Manoj for confirming. Okay? So let everyone join. We will wait for a minute. And after that, we will start the session. Today is the last day of microbiology. So I'm going to finish everything, whatever is left. Okay. So after today's session, microbiology will be, the super simple subject for you. And I challenge all the 13 questions out of 300 that you get directly from the microbiology that you are correct. That will be from the sessions only that I can take the guarantee, and that will be correct. And you will be able to solve them. And whether the integrated question, direct question, image-based question, you will be able to solve that. 13 are direct, but if you include the integrated also, the count will be 25. And it's not a less, it's not a less number. Okay? Okay, let everyone join. We will start. So till now, we have completed the general microbiology. We have completed the bacteriology, immunology. We have completed the bacteriology. And yesterday, we have completed virology also. Okay, ji? 2 more sections are still pending. So, mycology and parasitology. So, parasito is still pending and myco is still pending. A little bit about the clinical, few questions. I mean, only 1 or 2 topics is there. So these all, and there are few topics which are left in the immuno, maybe transplant, 1 or 2 topics, and maybe sterilization I left here. So I will take that also. So first we will finish whatever is left. So left out is parasito and myco, the biggest section. So the plan is that in the first 1 hour or maybe 1.5 hour, I'm going to complete myco. Maybe relatively in 1 to 1.5 hour. And after that we will start the parasito. So the plan is that till 5 o'clock we can finish the parasito also in the evening. It's big section, including the lunch break and all. Okay. And after that, we will take the pending immuno and general. That will take 1 more hour. Okay. So total in the 8-9 hours, whatever, till what in the evening. But today we have to complete. We will not left anything untouched. So after today's session, you will feel like confident in the microbiology. So I guess most of the students have already joined. Can we start the session? Can we start the session? So you got my plan. So I am starting with mycology, the study of the fungus. Now please listen, mycology is a very small section. Mycology is a very small section. I will finish entire mycology in 1 hour. It's very small. Hardly I have to teach you 16 fungus. And a total 16 fungus in your syllabus. First, I will let you know the classification, and then one by one, fungus by fungus, we will take. Hardly we require 3 minutes on each fungus. They're very small, 3 to 5 minutes. So I have provided you these charts, charts of the fungus. So can you see the last 4 pages of the chart? I don't know the page number. I don't have it complete. Can someone tell me the page number of the charts, not the main notes, the page number of the charts? So I want you to follow that last 4 pages. 4 fungus on each page. So in the last 4 pages, I have provided you the 16 fungus. 4, 4, 4, 4. Have you found it? Have you found it? I'm absolutely fine, Lalit, today. So, methyl pred ka kamal. I have taken the steroid yesterday night and I'm absolutely fine. It was an emergency. That's why. Otherwise, I couldn't take the class today. The methyl pred ka kamal hai. Main badhiya hu. Anyways. Chalo, what's, yeah, page number 15. Thank you, Medico. So page number 15, 16, 17, 18. Please see the last 4 pages of the chart, not the main notes. Master charts, I mean. Master charts may, I want you to follow that. Whenever I am teaching you here, you follow. So 4 fungus here, 4 here, 4 here, and 4 here. So total 16 fungus are there in our syllabus. Okay, ji, total 16 fungus are there. We are going to finish that. Okay, that is the only mycology. Now, please, one more thing. I'm telling you, you are getting, like 13 questions from the microbiology. So take a challenge. 3 will be from myco. On an average, 3 will be from myco. So it's a very small section, yet very productive. So in 1 hour, you are going to secure 3 questions of your, the damn sure questions of your exam. So it's very important. Can we start? With this introduction, let's start mycology, the study of the fungus. Now we have studied the bacteriology, and I told you the classification of the bacteria. We divide them in 4 categories based on the gram staining. Gram positive cocci, gram negative cocci. You know that, bacilli and gram-negative bacilli. We have already studied the virology also, and we divided the virus into only two categories: DNA viruses, the 6th family, and RNA viruses, the 15th family. Now, I am going to start the mycology, the fungus. Fungus. So first you have to understand the classification. Here also bacteria by bacteria we have completed our syllabus. Here also virus by virus we have completed our syllabus. Now first you should know कि fungus होते कौन-कौन से हैं, which are the fungus in your syllabus. Then fungus by fungus, one by one we will complete our syllabus. Okay जी, है ना? So fungus में I will teach you two type of classification. The first classification is the morphological classification. Based on the morphology, I will teach you, we divide them in 4 categories. The second classification is the pathogenesis. Based on the diseases the fungus is causing. So here also we divide them in 4 categories. We will follow this classification ultimately, and in this sequence only we will take fungus by fungus. You got the overview? Let's start fungus, mycology. Okay, let's start it. So I taught you that I'm going to teach you 2 classification of the fungus. ठीक है जी. The first classification is the morphological classification we will take. The first classification is the morphological and then the pathological. So first see the morphological classification. These are the 4 categories of the fungus. The first category, can you see the first? These are known as yeast. What are yeast? You will say, ma'am, yeast are circular, spherical in shape, and they divide by budding like this. They divide by budding, small bud. So learn 2 property. They are circular, I mean spherical, and they divide by budding. So any fungus who is spherical and divide by budding is known as yeast. Okay, now look the third one. First look the third one. These are known as molds. What are molds? The shape is elongated, not spherical. The shape is elongated. Number 1, they have the branches. They are elongated, they are branching, and they divide by hyphae formation. These branches are known as hyphae. So they have hyphae formation. So here we have hyphae. We don't have budding, we have hyphae. So these are spherical with budding, and these are elongated with hyphae. समझ में आया? So yeast and mold. See the fourth one, dimorphic. Dimorphic is double. नाम में ये die means double. I mean to say at 37 degree they are spherical. I mean they are yeast, and at 25 they become elongated. I mean they become mold. है ना? So it is temperature wise. They can be yeast, they can be mold depending on the temperature. है ना? Now I left the 4th category. The 4th category is yeast-like. I mean, this is yeast-like. So actually, why they are known as yeast-like? They are yeast, but they look like mold. Mind my words. They are yeast only, but they look like mold, look-wise, है ना? So ये बहरूपीय हैं, है ना? They are actually yeast. Can you see? This is a yeast. It is dividing by budding. It is a yeast dividing by budding. Now you continue the birds. So this is a yeast. This is a bird. Again a bird. Again a bird. So I feel like it is a mold, but actually it is not a mold, है ना? So here also I can see these all are the hyphae. Actually, these are not hyphae. These are known as pseudo hyphae because they look like hyphae, but they are not true hyphae. They are known as. So you will say, ma'am, how we differentiate? Is it a true hyphae or pseudo hyphae? See the true hyphae. So true hyphae don't have constriction. They are parallel. But pseudo hyphae have the constriction in between. At the junctions, appreciate the constrictions. If you get the constrictions, it's a pseudo hyphae, not a true hyphae. How many of you got it? I'm drawing the 4 type of fungus in front of you. You will tell me what is yeast, what is mold, what is dimorphic, है ना? And what is yeast-like. So these are the 4 type of fungus. Can you tell me the features? You people are there. You people are not talking with me. That's why I'm asking. Yes, tell. So Manoj, Arunanchalam, can you please tell me what is yeast? Say, ma'am, yeast is spherical and it divides by budding. So this is the property of the yeast. A spherical structure will divide by budding. What is mold? See, ma'am, mold is elongated. It is elongated. It's not spherical and it is having branches. Can you see the branches? The branches are known as hyphae. So here we have budding, bud. And here we have hyphae. Here we have hyphae. These are spherical and these are elongated. They are absolutely different. Looking only we can identify whether it is a yeast or a mold. Now the dimorphic is double. So basically they can be yeast, they can be mold. So basically at 37 they are yeast and at 25 they are mold. Have I written opposite or is it true? I guess it is true. 37 they are yeast, and at 25 they are mold. So you have to learn. Yes. So you have to learn like that. Dimorphic. What is yeast like? So actually they are yeast, but they look like mold. They are yeast, but they look like mold. So what is the diagram? So they are spherical only, but they divide by budding like this, like this, like this. So you can find the branches also like this. You may feel it is a branch, but actually it is not a true branch. So you may feel like it is elongated, but actually these are the multiple buds. So we can find these are the hyphae. No, these are not hyphae. These are known as pseudo hyphae. These are not hyphae. This is true hyphae. This is pseudo hyphae. Pseudo hyphae have constrictions at the junction. I guess everyone got it. So basically, you should understand the fungus. है ना दोस्ती करो पहले सबसे. Then I will teach you fungus by fungus. है ना This is the classification. Nobody is going to ask you the classification. They are going to ask you the example in each category. So you have to learn the example in each category. That is important. Okay. So the examples are important. So let me start with the yeast. Okay. Let me start with the yeast. In the yeast, we have only two examples. Learn the two examples. Cryptococcus and Saccharomyces. Cryptococcus and Saccharomyces are the two examples of the yeast. है ना yeast like में only one example, Candida. In your question, if you are getting pseudo hyphae, answer is going to be Candida. Whatever the size of the question. Now, this year only, there was a big clinical question in this year FMG, I mean the latest FMG. So the students told me, ma'am, whatever was the question, there was a big clinical history. But we read the word pseudo hyphae. और आपकी बात याद आ गई कि pseudo hyphae means Candida. Yes, pseudo hyphae means Candida because only one fungus in yeast-like category, Candida. So Candida, whenever question will come on the Candida, you will get the word pseudo hyphae. Don't miss this clue. Pseudo hyphae means Candida. So only one fungus. है ना In the molds, we have 5 examples. You have to learn the 5 dermatophytes, Aspergillus, Mucor, Penicillium, Rhizopus. These are, but the dimorphic are the last category. You have to learn dimorphic. You get many questions out of that. So, dimorphic. So, it is Blastomycetes, Paracoccidio, Coccidio, Histoplasma, Sporothrix, and Penicillosus. So, please learn. Okay. Thank you. And not only bacteria, the complete micro will be like this. That is my guarantee. Not only 92, you will get 100 out of 100 from my notes only. That is my challenge. है ना सब कुछ covered है. All PYQs, all expected question, all image-based question, all clinical question. You don't have to wander here and there. Just read my notes. That's it. Okay, blindly you can trust. Anyways, chalo. So this is the classification we have read. This is the first classification. Okay, the first classification is done. So yeast-like, mold, and dimorphic. Okay, diagram wise. Okay, you got diagram wise. I want you to learn the examples. In the yeast, we have only 2 examples. What are the 2 examples, people, in the yeast? What are the 2 examples? See, ma'am, Saccharomyces and Cryptococcus. Crypto and Saccharomyces, है ना yeast like में तो एक ही है. Don't forget Candida. You can't afford missing that. है ना mold में there are 5 examples you have to learn. The important one are dermatophytes, Mucor, है ना Penicillosus. 2 more are there. You please learn. And in the dimorphic, it's Blasto, Paracoccidio, Coccidio, Histoplasma capsulatum. These all will be the dimorphic. है ना so please learn Sporothrix. ठीक है जी है ना This classification wise you get the question. Okay, classification wise you get the question here. Yes, Aspergillus is also there here. Okay, so the same diagram. Can you identify the structure? बोलो ये क्या है? You say, ma'am, it's spherical and dividing by budding, so it's a yeast. Yes, absolutely right. What are these two structures? Both of them are branching. Both of them are elongated, branching. So both of them are molds. Basically, molds are of 2 types. They can be aseptate. There is no septa in them. Aseptate means no septa. And they can be septate. They can have the septa. But the branch is both of them. Can you see the branch? Let me appreciate you the branches. You can see the branch here also. You can see the branch here also. The branching is known as hyphae. So hyphae is present in both of them. Both are elongated. And can you see the structure? So it is looking like mold, but actually it is yeast because I can appreciate the constrictions. It is a true branching. It is not a true branching. It is a pseudo hyphae. So this one is yeast-like. I hope you can identify the diagrams. You can get an image-based question on that. But this classification-wise, you get many questions. But the second classification, I'm going to teach you 2 classification of the fungus. Now, first classification we have already done. Now, second classification. The first classification was based on their shape. Yeast-like, mold, and dimorphic. Based on the shape, we have divided. Now, the second classification is based on the diseases. What the fungus is causing. The diseases, pathogenesis. There are 4 or 5 categories. Some fungus involve only superficial layer of the skin. The keratin. The dead layer, the keratin of the skin, hair, and nails. Skin, we have keratin at 3 places in the body. We have keratin in the skin, we have keratin in the hair, and we have keratin in the nails. That is the dead layer. We cut hair, we cut nails, we don't have pain. Keratin, the superficial layer, if we scratch it out, thumb में कभी निकलता होगा आपका या palm में, तो we don't have pain because it is a dead layer, keratin. So disease of the keratin is superficial mycosis. So there are 4 fungus which involve the superficial layer. Superficial mycosis. है ना? So I will teach you here 4 diseases: dermatophytosis, tinea versicolor, tinea nigra, and pedra. I want you to open page number 15 of the chart. Please mind, not of main notes. भाई main notes के नहीं, जो master chart दिए ना, if you have taken the printout, you should have taken the printout, है ना? इनके printout तो लेना compulsory है. So इसका page number 15 निकालो. Can you open the page number 15 of the chart if you have it right now? Please open it. So 4 fungus, these 4 are given there on the page number 15. So one by one, I want you to follow that chart only. जितना chart में दिया है, just learn that. And if you want to open the main notes, what is the page number of the main notes, people? Chart में it is page number 15. Main notes में कहाँ से start हो रहा है fungus? Can anyone tell me? Help me. Main notes में fungus कहाँ से है? किसी ने नहीं खोला अभी? From where we are starting? Page number 78, people. So if you want the main notes, open main notes. But my advice, the charts are sufficient. It's your choice. It's your call. Hana, so on page number 15, all 4 are given. Have you checked? Have you checked? All 4 are given. Dermatophytosis, tinea versicolor, tinea nigra, and pedra. Yes, all 4 are given on page number 15. So this is the superficial. Just below the superficial, we have subcutaneous layer. So there are 4 fungus which involve the subcutaneous layer, not the superficial. Superficial के नीचे subcutaneous layer is there. So there are 4 fungus: mycetoma, sporothrix, chromoblastomycosis, rhinosporidiosis. Please see page number 16 of your chart. The next page, the next 4 fungus. So I'm going to teach you all 4 one by one. है ना? Hardly 3 minutes on each fungus. They're very small. है ना? Maximum 5 minutes on each. They're very small. Just read the charts. है ना? My guarantee the question will be from charts only. Okay. Whatever extra diagram वगैरह you can draw there only in the chart. And if you want कि नहीं मैम elaborated ही पढ़ना है तो main notes खोल लो. ठीक है? So there are 2 type of students in the class. कुछ बोलते हैं कि नहीं short में दे दो, कुछ बोलते हैं नहीं पूरा पढ़ना है. So I'm prepared for both the students. जिसको जो चाहिए रखो. Ultimately the knowledge is same. ठीक है ना? Ultimately you have to learn it. जहां से भी learn करो. The same, whatever is given in the chart, the elaborative form is given in the main notes. So it's your choice, it's your call. ठीक है? Now we have seen the superficial 4 fungus. We have seen the subcutaneous 4 fungus. अब और deep चले जाओ. Deep in the blood. There are 4 fungus which go in the blood. And they cause systemic multiple organ involvement. These are known as systemic mycosis, also known as deep mycosis. Deep or systemic is one and the same. So we have 4 fungus here: histoplasma, blastomycosis, coccidio, and paracoccidio. Blasto, coccidio, paracoccidio, page number 17. So the 4 fungus you can check: 4 on 15, 4 on 16, 4 on 17. है ना? 4 4 4. ठीक है जी. And finally, so superficial is done, subcutaneous is done, deep is done. है ना? 4 superficial, 4 subcutaneous, 4 deep. After that, 4 opportunistic fungus. What do you mean by opportunistic? They do not cause disease in healthy people. They cause disease in immunocompromised people only. The person already have AIDS. The person have, due to any reason, the person is on steroid. The person is on chemotherapy drugs. है ना? So immunocompromised people. So learn 4 fungus here: Candida, Cryptococcus, Zygo, Aspergillus. These 2 are also there, but not important. So I will teach you 4 here. So page number 18. You can see page number 18, the 4. Right? So these 16 fungus, 4, 4, 4, 4, I am going to teach you. Hana? The last one is the mycotoxicosis. That I will not teach you, just understand the meaning. Mycotoxicosis. Fungus do not cause the disease. Fungus secrete toxin like bacteria, and toxin cause the disease. So here the example is Aspergillus and Claviceps. Just learn it. I will not give the detail. So this is the classification. How many of you got it? Huh? Any problem in understanding? So can you help me in the classification once? So the classification of the fungus based on diseases, the pathogenesis. So learn the 4 categories first. है ना? The first category is the superficial. ठीक है? Superficial के नीचे आता है subcutaneous. ठीक है? Subcutaneous. उसके नीचे आता है systemic or deep. Or last है opportunistic. And mycotoxicosis is not important. You can remove also. So tell me 1, 2, 3, 4, 1, 2, 3, 4, 1, 2, 3, 4, and 1, 2, 3, 4. The 16 fungus in your syllabus. On 4 pages I have compacted. Okay. First learn their names. सबसे पहले तो. So here in superficial I will start with tinea versicolor. Then I will teach you tinea nigra. Then I will teach you pedra and dermatophytosis. In this sequence on page number 15 I have given all 4. है ना? Coming on the subcutaneous, I will teach you another 4. I will teach you mycetoma. Then I will teach you sporotrichosis, rhinosporidiosis, and one more we have here. Now, can you help me with the 4th name? Rhinosporidiosis and one more. What one more we have? Yes. So what one more we have here? Mycetoma हो गया, sporothrix हो गया, rhinosporidiosis हो गया. What one more I'm missing? Chromo. Very good, very good. Thank you. Thank you for Prabhangal for reminding chromo. So there are 4 here in the, so page number 16, I have compiled all 4 just like that. System, you can make some mnemonics also if you wish. Here, histo, blasto, coccidio, paracoccidio. Very easy. Histo, blasto, coccidio, paracoccidio. In the sequence only I'm going to teach you. So 4 on the page number 17. And opportunistic, I will start with Candida. Then I will move on Rhizopus. Then I will move on Aspergillus. And last is Cryptococcus. So I will teach you these 4 also, page number 18. So 4, 4, 4, 4. I want you to learn this classification. So we are done with the 2 type of classification of the fungus. I'm summarizing. Please concentrate. The 2 type of classification of the fungus. The first classification based on the morpho, the shapes, morphology. The second classification based on the diseases, that is pathogenesis. Pathogenesis matlab diseases. So here we have 4 categories, 1, 2, 3, 4. Here also we have 4 categories, 1, 2, 3 and 4. So first, here we have yeast-like, we have mold, and we have dimorphic. And you should know the examples under each category. And here we have superficial, we have subcutaneous, we have systemic, या फिर deep, and we have opportunistic. So I want you to learn the examples. Fungus तो total उतनी ही है ना? इस classification में कौन सी कहाँ है? इस classification में कौन सी कहाँ है? So you get many MCQs on that, many PYQs on that. Got it? Give me a thumbs up. Can we proceed? Solve some questions on that. You will have a clue. Read the question, tell me the answer. Which of the following fungus exists in yeast form at 37 and hyphae form at 25? So basically what they are asking, a fungus which is yeast at 37 and hyphae at 25. So they are asking you dimorphic fungus. So basically which of the following is an example of dimorphic? Open your classification and tell me the answer. Suji, absolutely right. Let me open the telegram also. Okay. Yes, so which of the following? Is it Malassezia furfur, Cryptococcus, Aspergillus or Histo? So histoplasma is coming. You can see in the classification, here is the histoplasma. You can see. And you can see other 3. Other 3 bhi dekhna hai. So Malassezia furfur is one of the dermatophyte. It's coming here. है ना? Aspergillus is also coming here. ठीक है? And Cryptococcus is coming here. So you can see the other 3 are coming in other categories. They are asking dimorphic. So only one of the option is coming here. So you will become double sure. So answer is D. How many of you confident with me? Coming to the next question. Okay, next question. You get many questions. मैंने एक ही डाला है, but you have many questions on the classification. So let's start the fungus by fungus. The 16 fungus. 5 minutes on each. We will quickly complete it. Anna, I suggest you to open page number 15 to see the 4 fungus one by one. If you want to go with the main notes, open page number 79. So these 4 I am going to start. I will first teach you superficial. I will first teach you tinea versicolor, then tinea nigra, then pedra, then dermatophytosis. One by one we will complete. So let's start with the first one, tinea versicolor. Let's start with first one. मेरी बात सुनो. These 4 are the name of the diseases, not fungus. These 4 are the diseases caused by the fungus. Mind my words. These all are the name of the diseases. These are not fungus. These are the name of the diseases. Now tell me the causative agent of tinea versicolor. First, tinea versicolor is also known as pityriasis versicolor. Write down other name. If I have not written, you can write down. Tinea versicolor, also known as pityriasis versicolor, and it's a disease. It's not a fungus. It is caused by a fungus. The name of the fungus is Malassezia furfur. और कहाँ पढ़ा है Malassezia furfur? Day 1 पे I told you somewhere. कहीं तो पढ़ा है. I told you super antigen. हाँ? Super antigen के 10 examples. 10 examples में 5 were bacteria, 4 were virus, 1 was fungus. The one fungus is Malassezia furfur. You can write down its super antigen. वहां पढ़ा के आई हो. You can cross check. Yes, it's a super antigen. So Malassezia furfur causes tinea versicolor or pityriasis versicolor, one and the same thing. है ना? So what are the symptoms? What are the symptoms? Number 1, patient have hypopigmented, hyper or hypopigmented patches. Number 1, hyper or hypo, mostly hypopigmented patches. Number 1. Number 2, patient have dandruff. Number 2, patient have dandruff. Dandruff is a disease in the hairs. है ना? Dandruff. The dandruff is known as seborrheic dermatitis. What is the dandruff known as? Seborrheic dermatitis. So basically, it causes hyperpigmented patches. Number 1. Number 2, it causes seborrheic dermatitis. That is dandruff. Number 3, there's infection of the hair. Folliculitis, matlab hair follicle infection. So this disease have 3 symptoms. है ना? Maybe I have written the symptoms also in the chart. Okay. Is my sound is not clearly audible? Let me check. My sound, Arshad is saying the sound is maximum from my side, I guess. I have to go otherwise in the settings of the OBS. Is the sound is good? What other people say? Incoming voice is low. Is it clear? Is it clear, everyone? I guess you should reconnect. Or should leave the class and I guess reconnect. There may be some network issue at your end. है ना? Okay, but low incoming है. Okay. I don't know. From my side, settings are not changed. Otherwise, I have to ask the team, technical team, they should change some setting in the OBS otherwise. If there is a problem, kindly let me know. Maximum students are feeling we can do so. Otherwise, we will continue and break में देखते हैं फिर. ठीक है? चलो. So we have seen the first fungus. We have seen the first fungus, Tinea versicolor, Pityrosus versicolor. We have seen the causative agent. We have seen the symptoms. How you make the diagnosis? How you make? You take the scrapping of the dandruff. You take the scrapping of the skin. Scrapping of the skin and scrapping of the dandruff you can take है ना. Lab diagnosis, that is a specimen. Lab diagnosis में we will do two things, we will do three things. तीनों पे क्वेश्चन है, देखो तीनों का डायग्राम भी है. We will do three things. Number one, you do direct microscopy. You do direct microscopy. In the direct microscopy, see what this is Malassezia furfur. See what you are getting. We can see the elongated form. Can you see the elongated form is the mold? Elongated form is the mold. Elongated form is the mold. It is looking like noodles. Have you seen the noodles? I know, Maggie noodles. And can you see the circular forms? The circular are also. I'm getting both forms. I mean, I know, elongated also and spherical also. The spherical balls are looking. The spherical forms are looking like meat ke pieces, meat ke small pieces. Dish. I don't know whether you have eaten or not eaten. The noodles are known as spaghetti. है ना? So the name of the dish, it is looking like a dish, spaghetti and meatball appearance. What is known as spaghetti? Spaghetti matlab noodle, spaghetti. And meatball is meatball. It look like a ball, है ना? Meatball. So we can see the spaghettis, we can see the meatball. Basically the spaghettis are the mouths and basically the meatballs are the yeast and we are getting both. So typical appearance. You get question on that. Spaghetti and meatball appearance. Meatball appearance is seen in which fungus? Answer is Malassezia furfur. Answer is this. Please learn. This is direct microscopy. You can get an image-based question also. In the image, you should be able to identify. Say yes. Coming on the culture. If you do a culture on SDA agar, for fungus, we always use SDA agar. है ना? Seberod agar, SDA agar. What is the appearance of the colony? I can see the colony. Have you ever tried hatching an egg on a pan? Fried egg khaya hai kabhi? So you can see it's looking like the egg, the boundaries of an egg. है ना? Egg on a pan, fried egg. So it is known as fried egg colony. It is known as fried egg. In bacteriology also, yesterday I taught you one of the bacteria showing fried egg appearance. Can you help me? Can you help me with that bacteria? Mycoplasma. The bacteria which don't have cell wall. याद आया क्या? Mycoplasma. The selective media was PPLO. Mycoplasma PPLO पे fried egg देता है ना? और Malassezia furfur SDA पे fried egg देता है. So we have two fried egg in microbiology. Number one, Mycoplasma, which is a bacteria. Number two, Malassezia furfur, which is a fungus. है ना? So this is giving on PPLO agar, which is the selective medium. यहाँ पे this is SDA agar, and both of them giving the fried egg appearance. Say yes, the colonies. दोनों पे PYQ है. Please correlate. ठीक है, चलो ये हो गया. The third is wood lamp. What is wood lamp? This one is wood lamp. What do you mean by wood lamp? Wood lamp एक lamp है जिससे UV light निकलती है. It's a lamp from which UV light emit, है ना? So that is a wood lamp. So don't take any sample. Just this is the dandruff now. Put UV lamp on that. So as soon as UV light will fall here, it will show the fluorescence. If it is having Malassezia furfur, it will show the fluorescence, golden yellow fluorescence, because Malassezia furfur is a pigmented fungus. Yesterday I taught you two pigmented bacteria. This is a pigmented fungus. So please learn the three things. Let me summarize. Tinea versicolor and Tinea pityrosus. Look at your chart. What you have to learn. Number one, tell me the causative agent. है ना? इसका causative agent कौन है? आपको वो बताना है. Number two, you have to tell me the symptoms. 3 symptoms. And number 3, you have to tell me the diagnosis. 3 ways of diagnosis. That's it. 3 ways of diagnosis may be what do you get on direct microscopy, what do you get on culture, what do you get on wood lamp. है ना? That you have to tell me. And a question will be like this. So tell me answers. Chalo, fatapat. Who will tell me? Who's the causative agent? Tinea versicolor, pityrosus versicolor. Causative agent कौन है? Say ma'am, Malassezia furfur. Malassezia furfur. नाम ही इतना यूनिक है, you will never forget. है ना? Please learn. 3 symptoms. Number 1, hypopigmented patches. Remember the diagram. Number 2, dandruff. Dandruff is seborrheic dermatitis. Seborrheic dermatitis. And number 3 is folliculitis. ठीक है, चलो. Tell me how you do the diagnosis. Direct microscopy पे very important. Spaghetti, meatball appearance. ठीक है, you get image also यहाँ पे. Image based question. Number 2, culture पे क्या मिलेगा? SD agar. SD agar पे क्या मिलेगा culture में? What do you get? You will get fried egg colonies. Fried egg colonies, you can get image also. And wood lamp, you will get fluorescence. You will get fluorescence. Which fluorescence? Golden yellow fluorescence. because it is a pigmented fungus. Question will be not out of that. अगर इस पे question आया तो इसी में से आएगा. That's all. Everything is written in your chart. Can we proceed to the next fungus? Fungus number 2. 16 पढ़नी है, एक हो गई. Can I come on the second? Say yes, people. Say yes. Can I come on the second fungus? So start the second fungus. Tinea nigra, very small fungus. Tinea nigra. Again, Tinea nigra is a disease. It's not a fungus. It's a disease. It is caused by a fungus. Learn the name of the fungus. The causative agent. The causative agent is Hortia wernicki. What was the causative agent there? It was Malassezia furfur. Here, Hortia wernicki. You don't have to learn. You have to pick from the option. भाई option में लिखा हुआ आएगा A B C D. You have to pick the Hortia. Hortia वाला ये है. Hortia wernicki. है ना? What are the symptoms? Only one symptom. Painless, black, non-itchy patches. Painless. There is no pain. There is no itching. There is no scaling. No pain, no itching, no. Only a black color patch on the palm and sole. On the palm and the sole. That's it. That's it. And it says spotter. मतलब diagnosis के लिए कुछ खास नहीं है. That's it. We are done with second fungus. Coming on the third fungus. The third fungus is pedra. Fungus are very small. है ना? The third fungus is pedra. Please learn the meaning. Pedra is a disease of hair. It's not a disease. This was a disease of skin of the palm. This was also a disease of the skin. है ना? Dandruff भी था और skin. So यहाँ पे skin is also involved. Hairs are also. Hair में भी skin involved हो रही है. Hair is not involved. The skin of the hair have the dandruff. So it is a disease of the skin. Tinea versicolor. है ना? Tinea nigra is also a disease of the skin. You can see. But pedra is a disease of hair. Absolutely hair. There is no skin, no nail, only hair. So the hair will be like this. Let me tell you. Let me draw two hairs for you. So this is a hair. This is a hair. है ना? In the hair, black nodules can be there. है ना? This is known as black pedra. In the hair, white nodules can be there. White nodules. This is known as white pedra. So there are two type of pedra. है ना? Black pedra, white pedra. Black pedra. This is a disease. Black pedra में black nodules. देखो ये black nodules हैं hairs में. Can you see the black nodules? और ये white pedra है. The white nodules. Disease is same. The color of the nodules is different. In the entire hair, small nodules are there. You take one hair, you get multiple knot-like nodular structure in the hairs. Multiple hairs. I know. So that is a disease. So black pedra, you have to learn the causative agent. Gande naam hai, but you have to learn. Chalo. So black pedra is caused by the name of the causative agent is Pedria hortia. है ना? Pedra से pedra याद आएगा. Pedria hortia. लेकिन white pedra is caused by Trichosporon bigeli. I know it's difficult, but you don't have to write. If you ask me to write, I will also do spelling mistake and all. But in the option, we can identify. In the options, we can identify. उतना याद करो कि in the 4 option, you can pick up. That is the thing. Okay, G. So what I taught you, till now I taught you 3 fungus. है ना? Tinea versicolor, Tinea nigra, pedra. You have your charts with you and you are marking in that. Tell me the causative agent. Versicolor, Malassezia furfur. Nigra, Hortia wernicki. And pedra, there are 2 pedra, black and white. The black is caused by Pedra hortia only. And the white is caused by Trichophyton bigeli. Say yes, people. Say yes. So what should I repeat in Pedra, Harsh? Pedra is a disease of hair. And there are nodules in the hair. The black Pedra have the black nodules. And the white Pedra have the white nodules. That's what I have told. That is the only disease. Got it, Harsh? The causative agent of both of them is different. The black is caused by this. The white is caused by this. You have to learn the causative agent, the name of the 2 fungus. The causative agent is different. Hannah? And the disease is in front of you. Got it? So black pedra have black nodules. The white pedra have white nodules. So here we don't have diagnosis here. We don't have diagnosis here. But here we have 3 ways of diagnosis. I told you. Hannah? Direct microscopy पे spaghetti and meatball appearance. Culture पे fried egg colony. And wood lamp पे fluorescence. But here we don't have any important lab diagnosis that I should tell you here. Okay, got it? Okay, nodule is irregular in pedra. Nodules is irregular. Means I didn't got your question. I don't know nodules are regular or irregular. I don't have any this thing. Like you are asking the distance between the nodules. I don't have any knowledge in that. They will not ask that. I mean, just learn that pedra is a disease of hair. That you must know. And there are 2 pedra, black and white. Learn the causative agent. That's it. Don't go in the detail. ठीक है ना? Whether the nodules are regular or irregular, I will not bluff, but I will not have any knowledge about that. I will check. I mean, okay. Anyways, coming on the 4th one, dermatophytosis. So can we go on the next one? Dermatophytosis, the 4th and the last disease here. Hana, in the superficial. Then after superficial, we will come on subcutaneous. Okay? So superficial, the 4th and the last fungus is dermatophytosis. Dermatophytosis. So this was a disease of skin. This was also a disease of skin. This was a disease of hair. है ना? This causes all three diseases: skin, hair, nail. Skin, hair, nail. All three diseases are there. Skin is also there, hair is also there, nail is also there. Okay, so let me come on the dermatophyte. Before that, let's solve some questions on these three. Chalo, read the question and tell me the answer. Seborrheic dermatitis ka causative agent. You get simple questions from the fungus. Okay, so seborrheic dermatitis is caused by which agent? Fatafat, I don't have time. Chalo, jaldi, chalo. Is it Candida, dermatophytes, Cryptococcus or Malassezia furfur? Obviously, it's Malassezia furfur. Malassezia furfur causes dandruff. That is seborrheic dermatitis. Okay, ji, है ना? Read the next question. Fried egg colony on SD agar. Very easy question again. Very easy question again. So what is the answer here? It's again Malassezia furfur. So fried egg colony on SD agar. Again, the answer is Malassezia furfur only. Okay, Malassezia furfur. If I change the question to spaghetti and meatball, would you like to change your answer? No, still answer is Malassezia furfur. If I change the question that fluorescent on wood lamp, again the answer is Malassezia furfur. So you get all three questions on that. Let's come on the fourth fungus of the superficial mycosis and finish superficial mycosis. So the fourth fungus is dermatophytosis. The fourth fungus is dermatophytosis. So as I told you, Hindi में से कहते हैं दाद. सुना है? दाद खाद खुजली दाद. So it is known as ringworm. Ringworm. So that is dermatophytosis. Again, it's the name of the disease. These all are the name of the diseases. You have to learn the corresponding fungus. As I told you, Tinea versicolor. The corresponding fungus is Malassezia furfur. Tinea nigra. It's a disease. The fungus is Hortia warniki. Pedra. You know the two fungus which is causing black pedra. So here we have three different fungus. Dermatophytosis mein there are three different fungus. Please learn the names of the three fungus. The first is the trichophyton, number 1. Number 2, microsporum, number 2. And number 3, epidermophyton. So TME you can learn. Trichophyton, microsporum, epidermophyton. These are the three fungus which all of them causes the disease dermatophytosis. So dermatophytosis disease का नाम है, इसे कहते हैं दाद, है ना? And that is caused by the three fungus, one of the three fungus. You know दाद तीन जगह हो सकता है, skin, hair, nail कहीं भी हो सकता है. The dermatophytosis can occur in all three. So basically try, देखो ऐसे learn करो, learn, try मतलब triple ना, triple. It causes infection in the skin as well as hair as well as nail. So you will not forget, skin भी है, hair भी है and nail भी है. It causes disease of all three. Skin is everywhere. Skin में ये भी कराएगा, ये भी कराएगा. ठीक है? The second is microsporum. In microsporum, skin is there. Skin is everywhere. But micro मतलब very small. Hair कैसा होता है? Hair is a very thin structure. Micro. So I remember like micro वाले में hair. So skin and hair. Only skin and hair because it is micro. And the third one, epidermophyton. You know, skin and nail. So I learned the three causative agent. I'm teaching you dermatophytosis. It's the name of disease. It's not a fungus. So there are three fungus which causes it. Trichophyton, microsporum, epidermophyton. Learn the name of the three fungus. Now you get many words in the mycology. वो तो learn करने पड़ेंगे. Either learn or make sure that you will identify in the option if you're not learning. So make sure you will identify in the option. ठीक है? So trichophyton, microsporum, epidermophyton. Tri, triple. It causes disease of skin, hair, and nail. Micro, it causes disease of skin, but micro मतलब very thin. So it involves only hair. And epidermo, along with the skin, it involves nail. Say yes. Yes, skin is in all three, Elizabeth. Absolutely right. So this is how you can learn. And this is triple, try. So all three are there. है ना? Micro में very thin structure, that is hair, और बचा जो भी उसमें nail. This is how I learned. ठीक है? You can make your way. So this is the causative agent. Now let me tell you the name of the diseases. Symptom. सबसे पहले ले लो scalp. This is our scalp. In my scalp, I am having two things. Number one, my skin of the scalp. Number two, my hairs of the scalp. So there are two diseases in the scalp: the skin disease and the hair disease. है ना? The disease of the scalp is known as tinea capitis. Cap से याद आएगा. We put cap on the scalp, ना? Capitis मतलब cap लगाते हैं हम. So tinea capitis. The name of the symptom, the name of the disease of the scalp is tinea capitis. I'm sorry. Two diseases occur in the skin and two occur in the hair. है ना? Skin of the scalp and hair of the scalp. All four diagrams in front of you. Two in the skin, two in the hair. All four are in scalp. That's why all four together known as tinea capitis. Tinea capitis is together. All four together. Say yes. What are the two disease in the skin? In the skin we have carrion and flavus. What is carrion? Carrion is a boggy swelling. Boggy swelling in the skin. Learn the word boggy. Boggy swelling in the skin, है ना? And flavus Favus is also a lesion in the skin, but it is not boggy. Learn the word crusting. है ना, पपड़ी जैसा निकलेगा पूरा. Person will scratch and a crust will come. Again the person will scratch and a crust will come. Crusting lesion. है ना? So this is boggy, this is crusting. The boggy one is the cavion, the crusting one is the favus. Say yes, say yes. So carry on. Here the boggy swelling and favus, it is a crust-like lesion. You can learn. Okay? So these are the two diseases of the skin, not two diseases of the hair. In the hair, arthrospores are there. Arthrospores are the spores in the fungus. है ना? So arthrospores are outside the hair or inside the hair. They get deposited, arthrospores. So if they are outside, it's ectothrics. You can see they are deposited outside. And if they are inside, they are known as endothrix. So say the four diseases. Say, ma'am, tinea capitis. Capitis matlab disease of the scalp. So we have two diseases of the skin, two of the hair. है ना? What are the two diseases of the skin? Say carrion and favus. And two diseases in the hair, acto and endo. Acto and endothrix. Okay. So carrion is a boggy swelling. Carrion is a boggy swelling. Favus is a crust-like swelling. And here we have arthrospores outside, and here we have arthrospores inside. How many of you got it? Please learn it now. This is tinea capitis. Now, what is the causative agent? So I told you there are three causative agents now: trichophyton, microsporum, and epidermophyton. I told you now. So you can see skin is there in all three: hair, and nail. Here only hair, here only nail. This is how I told you. So there are multiple. This is the name of the genera. There are multiple species of T, multiple species of M, and multiple species of E. So I'm telling you two diseases of skin and two of hair. है ना? So hair wala cannot be caused by epidermo. Let me tell you the causative agent. I mean what I'm telling you here now. What I'm telling you here now is the causative agent. Listen. I want you to learn that carrion is caused by trichophyton. कौन सा trichophyton? Trichophyton verrucosum. It is a disease of skin ना. It is caused by trichophyton verrucosum. And favus is caused by trichophyton schonchleini. Just identify in the option. Just identify. Don't learn कि भाई ये क्या है इतना. So just identify option में आएगा, है ना? इनके भी causative agent है. You can see, but don't learn. PYQ verrucosum पे आ चुका है. There is a PYQ on verrucosum. Already there is a PYQ. So they can ask you again. है ना? So learn the causative agent. Can we proceed? So ये तो सिर्फ scalp हुआ. Body में हर जगह दांत खाद खुजली कराना है. We have to do ringworm everywhere on the body. We started with scalp. Now let's come on the face. Let's come on other parts of the body. Let's come on the nails. One by one we will see. Scalp is done. In the scalp we have four things. We are done with the scalp. चलो आगे आएंगे. Tinea corporis. This was tinea capitis. Capitis is done. In capitis I told you four diseases. We will revise all in the end. ठीक है? Tinea corporis. Corporis is any part of the body which is non-hairy. You can see any part of the body which is non-hairy. है ना? It is known as corporis. Just learn the side. The next is tinea pedis. नाम में ही है pedis. Pedis मतलब पैर, foot. Foot को कहते हैं pedia. Pedis. It is known as athlete foot. So here infection, the dad, ringworm occurs in the web spaces of the foot. Pedis. Athlete foot, also known as athlete foot. The infection is in the web space of the foot. The next is tinea cruris. Cruris का मतलब होता है groin region, है ना? The area around the penis and the area around the vulva, the groin region, है ना? It is known as joke itch. Can you see in the groin where sweating is maximum? So in the groin region, very common the ringworm infections are there, है ना? Because of poor hygiene sometimes and maybe due to sweating, है ना? It is known as tinea cruris. So you already have a PYQ on joke itch. You should learn that joke itch is tinea cruris. You should learn athlete foot is tinea pedis. है ना? Just learn this is groin and this one is web space of the foot. Okay. The next is tinea barbi. You know barber. Barber क्या होता है? Who's a barber? Just a second. Who's a barber? The barber is the beard and mustache area in the males. In the beard and mustache, दाढ़ी और मूंछ वाले area में. If the ringworm infection is there, it is known as tinea barbi. Barbi is beard and mustache. Tinea facie. Apart from barbi, any other area of the face. Any other non-hairy area of the face. Tinea facie. है ना? Tinea facie. The next is tinea imbricata. Imbricata is concentric lesions. Anywhere. But they are concentric. Anywhere. It is imbricata. है ना? The next is tinea unguium. Unguium का मतलब होता है nail. So there is a ringworm. दाद है लेकिन nails में. So it is there in the nails, not in the skin. It is in the nails. Tinea manum. The last is manum. It is on the palm. है ना? So ringworm infection of the palm. So just learn the location, please. That's it. I have put the diagrams also to learn you. So I told you tinea capitis, then tinea corporis, then tinea pedia, cruris, barbi, fascia, imbricata, inguinum, manum. You should tell me the location where they are. So you get simple questions on that. We are done with dermatophyte. Read the question, tell me the answer. Read the question, tell me the answer. Boggy swelling in the scalp. Boggy swelling in the scalp is caused by, what's the causative agent, people? What is the causative agent? I'm waiting. Is it Trichopaton versicolum, Candida, Mycetoma, Sporotrichosis? So boggy swelling is dermatophytosis. It is caused by Trichopaton verrucasum. So I told you right now to learn this verrucasum. Hannah. So we are done with these four. Anyone having any trouble with these four? Out of the 16 fungus, 4 are done. Okay, I'm starting the next 4. So I want you to open page number 18 of your charts. 18 number page, not 18, I'm sorry, page number 16. Okay, please open page number 16 of your charts. You will find these 4. So I will teach you these 4. Anyone having any trouble? So you are getting super simplified concepts in the mycology. Hana? So let's come on the next 4 fungus. We have seen the superficial now. Now we are seeing the subcutaneous. Hana? So there are 4 fungus. In all of them, the subcutaneous lesions will be there. Not superficial. No, subcutaneous lesions will be there. Which are the 4 fungus? 4 diseases. Mycetoma, Sporothrix, Chromoblastomycosis, Rhinospora. First learn the name. We will teach you. See in your chart also. Mycetoma, Sporotrichosis, Chromoblastomycosis, and Rhinosporidiosis. I will teach you these 4 one by one. है ना? Maybe the sequence जो भी chart में दी है, we will see the 4. ठीक है? So all the 4 they will cause subcutaneous lesion. Say yes. Got it? Say yes. They all, most of them, enter in human body by root is different. इन दोनों में root है thorn prick. I will tell you. चलो. ठीक है? Got it? So can we go ahead? है ना? The 4 fungus. They all are superficial. Not superficial. I'm sorry. Subcutaneous mycosis. So let's start with mycetoma. Let's start with mycetoma. Follow your charts. Mark it. Whatever I'm teaching you here, na, mark in your chart or notes. So you will have a memory that you have to learn. Retention होगा. Mycetoma. Learn the other name mycetoma. I don't know मैंने लिख के दिया है कि नहीं. जो भी missing है ना, please write it. Okay, got it. Treatment drug of choice, please learn. I have mentioned it ना. So please learn the drug of choice that you have to learn by yourself. In drug of choice of all the organism given in my charts, just read it once. Okay, ji, chalo. So mycetoma, also known as Madhura foot. Have I written? Why it is known as Madhura foot or Madhura mycosis? Have you heard about the Madurai? Madurai is a city in South India. Have you heard? So first case was discovered by Madurai, in Madurai. First case, that's why it is known as Madhura foot. Learn other name. Learn other name. Mycetoma, the other name is Madhura foot. Right? Now there are 3 types of mycetoma. One is eumycetoma, one is actinomycetoma, one is botryomycetoma. Listen. What is U? U का मतलब होता है true. U का मतलब होता है true. True मतलब असली, है ना? So this is caused by the fungus. I will tell you the agents, है ना? Actino. Have I taught you yesterday? Gram positive bacilli. There were 6 gram positive bacilli. A, B, C, D, L, M. याद आया क्या? Bacteria. Bacteria. What is A? A. Actinomycete. याद आया? इसमें 2 bacteria we have seen. Actinomyces and Nocardia. Both of them come under this category. Those who were attending my yesterday's session. So basically, it's a bacteria. Anna. So bacteria also causes this disease. But if it is caused by the bacteria, na, it is known as actinomycetoma. This is eumycetoma. This is actinomycetoma. I told you multiple sinuses are there. If you press it, the pus will come, discharging sinuses, and there will be granules. So same disease is caused by fungus also. Got it? So eumycetoma, actinomycetoma. U is caused by fungus. Actino is caused by the bacteria. You will ask, ma'am, which bacteria? My answer is actinobacteria, actinomycetoma. है ना? And third is Botry. Botry is caused by Staph aureus. Botryomycosis is caused by Staph aureus rarely. So what are the 3 types of mycetoma? Please write. You get many questions. Eumycetoma, actinomycetoma, Botryomycetoma. Say U मतलब true. It is caused by fungus. ठीक है जी? Actino is caused by bacteria. Which bacteria? Actinomycete. The 2 actinomycete, actinomyces and nocardia. ठीक है? And Botry is caused by Staph aureus. Please learn the 3 types. Okay जी? Now what is the claim? Whether it is this or this or this, the presentation is a triad. The presentation is a triad. Whether it is a eumycetoma, actinomycetoma or Botryomycetoma. But the clinical feature is same. It's a triad. Clinical feature is same. है ना? So patient have a tumor-like swelling. I'm saying tumor-like, not a tumor. It look like tumor, but it is not a tumor. है ना? It is a misnomer. It is not a tumor. It is known as tumefaction. It is known as tumefaction. Got it? Number 1. You can see multiple sinuses inside that. Can you appreciate the multiple small sinuses here? Multiple small sinuses are there, right? Number two. And if you press it, the pus will come. So don't say only the word sinus, say the word discharging sinus. They are not dry. They are not dry. There is a difference. If you say only sinus, it's not correct. Say discharging sinus. The pus come out of it. The pus. And if you see inside the pus, there are multiple granules. If you press, the pus will come. And if you feel the pus, inside the pus granules are there. If it is eumycetoma, the granule, if you crush the granule, it will have a fungal colony and a fungus colony. If it is a actinomycetoma, if you crush it, there will be a bacterial colony, or botryma, it will be staph aureus colony. So whatever is the organism, that colony is the granule. Say yes. You have to crush it and see. Say yes. Usually it occurs on the feet, and they are painless. They look horrible, but they are painless. Say yes. And later on, they involve the underlying bone also. Underlying bone, osteosclerotic, osteolytic lesions in the bone. Say yes, people. What is a triad? Got it? Mycetoma का triad बोलो, है ना? Okay, we will revise. ठीक है? We are done with mycetoma. इतना ही याद करना है. Is it given in your chart? Mycetoma. Elizabeth, Suji, Mega, are you following my charts? I forgot to take the printout. Yeah, I don't have the printout, but I know whatever I have written. I have made only these charts now, so I know I have written everything. So in mycetoma, you have to learn first the three types. The three types. Introduction, you learn other name. Okay. You tell me other name number one, है ना? Other name number one, mycetoma का. You tell me three types with their causative agent. Number two, you tell me the triad. You tell me the triad, matlab the symptoms, the triad of the symptoms. So other name is Madhura foot या Madhura mycosis. The three types is eumycetoma, actinomycetoma, and botryomycetoma. U is caused by fungus, say yes. Actino is caused by a bacteria, that is actinowala bacteria. Botry is caused by staph aureus. The triad you have to tell me. Triad में there is tumor like swelling, number one. उस swelling, imagine the diagram. Swelling के अंदर multiple sinuses. Don't say only sinus. Say discharging sinus to be specific. They are not dry sinus. They are discharging sinuses. And if you press it, the pus will come. The pus is not only pus. If you crush it, you will get the granules. Granules have the colonies. Say yes, है ना? So it's a spotter image also. एक बार ये image आ चुकी है and they ask you to identify it's a spotter. Answer is mycetoma. ठीक है, you get only these questions. You will say, now what is the diagnosis? There is no diagnosis. Looking at the image itself, patient का foot देख के समझ में आ जाएगा it's mycetoma, है ना? Number two, if you want to do the diagnosis, the specimen is the pus. You press, the pus will come. You press, the pus will come. Collect that pus. That will be your specimen. And in that the granules are there now. Crush the granule and see if it is a bacteria or fungus or staph aureus. Based on that, the diagnosis will confirm. Say yes. Say yes. Anything extra given in the charts not explained here, you can ask. Okay, apart from the treatment. Okay, yes, very good. Read the question, tell me the answer. All the state, and what is the treatment? Surgery. Treatment is surgery followed by Dapsone. What I have written in the treatment, can someone read? Surgery followed by what? Maybe I have written something in the treatment. No, surgery to hai hai, I'm sure. Followed by kya? Followed by antifungal. Which antifungal you can see? I guess it's Dapsone, but I'm not sure. Anna, so please. Okay, okay. Antifungal. So please, any antifungal will work. There is no specific. Where I have written depending. If it is eumycetoma, you have to give antifungal. If it is actino or botry, you have to give antibiotic. So first do surgery followed by the corresponding drug. And there is no specific drug here. Okay, G. Can we go? Chalo, read the question, tell me the answer. All the statements are true about mycetoma except, tell me what is false. Tell me what is false. People, fast. You have to coop up. Chalo. Eumycetoma is caused by bacteria. Is it true or false? No, it's false. You matlab true. It is caused by a fungus. Surgery is an important treatment. Yes. It's painless. Yes. Diagnosis can be made just examining the lesion. है ना? Lesion देखते से समझ में आ जाएगा. Yes. So rest all are true, but A is false. So you get many questions on this concept. Come on the next fungus here. I'm teaching you 4, ना? Subcutaneous में हमें 4 पढ़नी है. So I already taught you mycetoma. 3 more I have to teach you. So I'm starting the second one, chromo, है ना? Then I will go on rhino or sporotrichosis, and then last I will teach you rhino. Huh? So let's come on the next fungus. First is done, coming on the second, chromo, subcutaneous lesion, है ना? Subcutaneous, ठीक है? Yes. So coming on chromoblastomycosis, है ना? The lesion is verrucous in appearance. Highlight the word verrucous. सबका lesion typical है. वहां पे lesion कैसा था? Imagine the foot का diagram वहां पे. It was the multiple sinus with the pus. यहाँ पे देखो, there is no sinus, there is no pus, but you can see the verrucous lesion. It's a verrucous is there. Verrucous lesion. You will get the word verrucous lesion. So verrucous lesion matlab chromo. And if you take the biopsy, you will get this in the biopsy. What is this? See the diagram. What is this? What is this? You will say, ma'am, I can see circle, circle. So what are these circles? Huh? You will say, ma'am, circle to yeast hote hain. So are they yeast? Yes, these all are budding yeast, the circle. But the point is that they are brown in color. They are brown in color. They have a pigment, brown pigment. That's why they look brown in color. They look brown in color. They have a brown pigment in them. So does they look like copper penny? हाँ, copper का सिक्का देखा है? Copper coin. कभी देखा है copper coin? पहले ज़माने में चलते थे. अब तो नहीं चलते, है ना? Copper coin. Maybe you have at your home. It's like a copper penny, you can say. Copper coin, copper penny. So learn the word copper coin, copper penny. You get many questions on that. This is known as copper coin, copper penny, the hallmark, because of the brown pigment it is having. It is yeast, the brown color yeast. The brown color yeast, है ना? It is looking like copper penny. Number one. It is also known as sclerotic body. इसी को कहते हैं sclerotic body. Also known as medlar या muriform body. So learn four name: copper penny, sclerotic body, है ना? Muriform body, है ना? And Mudlar body, है ना? Muriform, Mudlar are not very important, but you get question on these two repeatedly. So it is a hallmark of chromoblastomycosis. So I suggest you, verrucous मतलब छोटे छोटे verrucki बन गया ना मेडिको. So verrucki यानी verrucous. So in chromo learn only two things. दो ही पे question आएगा, तीसरा question आज तक नहीं आया. So only two things you get the question. Number one, verrucous lesion, and number two, copper penny. Copper penny. If you take the biopsy of this, you will get copper penny. Copper penny, also known as sclerotic body, also known as muriform body, Mudlar body, whatever. So this is a diagnosis. Now here you can get a theoretical question, you can get an image-based question very frequently. And one more thing you can write, it enters the human body by thorn prick. शायद मैंने नहीं लिख दिया तो please write it down. कांटा लगा, हाई लगा, है ना? So thorn prick. So जहाँ पे भी thorn prick होगा, it enters in that. So usually it is very common in gardeners, है ना? Who the person who do the gardening. So you will get a question. There is a gardener. Gardener will be a clue. है ना? So they are talking about some disease which enter via thorn prick. So you can write down anywhere कि thorn prick से entry होता है. I don't know मैंने लिख के दिया है कि नहीं. ठीक है, चलो बढ़ेंगे आगे. So we are done with this also. Second fungus. Read, see, what is this? What you can see, people? What you can see? Say, ma'am, we can see the copper pennies. These are the copper pennies. This is the biopsy. Now you can get this image. You can get this image. The images are different, but the thing is same. Okay. Read the question. Tell me the answer. There is a female. Okay. Take the clues. There is a female having thorn prick. चलो सबसे पहला clue मुझे मिला thorn prick. ठीक है, 5 years ago. It's a chronic disease, not acute. चलो ठीक है. Now she presented with slowly growing 2 into 2 verrucous lesion. My second clue is verrucous. है ना? The imaging is given to you. I can see 3 clues. Number 1, thorn prick. Number 2, verrucous lesion. है ना? ठीक है, आंसर तो सबको पता है. Appreciate the approach. चलो thorn prick हो गया, verrucous lesion हो गया, और इमेज में ब्राउन कलर का yeast हो गया. ब्राउन yeast हो गया. तीनों का combination. Answer is only one, chromoblastomycosis. So you get straightforward question. Maybe language is different, clinical scenario is different, but घुमा फिरा के मतलब इतना ही होगा. Question सिर्फ दो ही चीजों पे आएगा. Coming on the next fungus, the third one, है ना? I have to teach you 4. We are done with mycetoma. We are done with अभी क्या पढ़ा है? Chromoblastomycosis. And I am teaching you rhino now. And after that we will go on sporothrix. So coming on the third one, rhino. ठीक है, you can take any sequence. ठीक है, चलो coming on the rhino. Rhinosporidiosis. It is no more a fungus. Yes, you heard me correct. या fungus है ही नहीं. Fungus बची नहीं है. We have changed the classification. It's a parasite. So you should say कि मैम अभी क्यों पढ़ा रहे हो? Why you are telling us right now? After mycology, you will teach us parasite today. So you teach us there, but in the books it is given still in fungus. And very recently its classification is changed. तो इस पे सबसे बड़ा क्वेश्चन तो ये है, it is classified no more under fungus nowadays. We have changed its classification. Actually its classification is controversial. Some says it's a fungus, some says it's a parasite. But now we are more towards parasite. And which parasite? It's a protozoa. It's a protozoa. So please learn. There are 2 types of parasite. Now I will teach you protozoa, metazoa. So it's a protozoa. And it remains in the water. So it enters the human body via swimming. Stagnant water, not flowing. Stagnant water. So stagnant water mein hoga. Via swimming it can enter. So please write down the important. Yes, it's the aquatic parasite. It remains in the stagnant water. It's not a fungus. It's a parasite. Write down, please, if it is not written. So it enters the human body via swimming from the water. Now water goes in the nose, water goes in the eyes, water goes in the mouth. Wherever it goes, it will make a polyp there. It will make a most commonly nose. So you will get a question on the polyp. Maybe on the nose, maybe on the conjunctiva, maybe in the buccal cavity, and anywhere, maybe in the ears. So polyp can be anywhere, but the polyp is there. The most important thing is polyp, most common in the nose. It can be in the ear, larynx, bronchus, genitalia, anywhere. Which part is exposed? Okay, okay. Can we go ahead, Hannah? So that is a thing. So this is the clinical feature. What about if I take the biopsy? What about if I take the biopsy? Okay, if we take the biopsy, this is the diagram. This is the diagram of the biopsy. In the biopsy, you can see spherules is the hallmark. What is the hallmark word here to be picked here? Spherules. Spherules. The hallmark word is the spherules. Here we have spherules. What is spherule? Inside each spherule, hundreds of endospores are there. Hundreds spores. And dot, 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 dot. It's not very clear visible, but you can see small dot-like structures. These are endospores. The hallmark is the spherule. We are done. So what we have learned? What we have learned in rhinosporidiosis? We have learned it's not a fungus nowadays. We have learned it's a parasite. Hannah, we have learned it's a protozoa parasite, it's the aquatic parasite. We have learned it remain in the stagnant water. We have learned it causes polyp. Most common in the nose, but at multiple organs it can cause. And finally, the diagnosis. The diagnosis is made by spherule. In the biopsy, you get spherule. Spherule. You can identify in the image also. Image-based question. Inside the spherule, multiple endospores are there. Can we proceed? We are done with this also. Read the question, tell me the answer. Rhinosporidium siberi, that is the organism that caused rhinosporidiosis. Learn the causative agent. Rhinosporidiosis is caused by Rhinosporidium siberi. Is it a fungus, bacteria, protozoa, or virus? What is the correct answer? People, yes, obviously, it's a parasite. It's a protozoan parasite. Hannah, it's aquatic protozoan parasite. The correct answer is C. Hannah, and you can get question on the polyp, image-based question. Hannah, I have put few prototype question. Just you know, sync up. बाकी तो तुम्हें खुद करना है जाके. पूरे questions नहीं हो पाएंगे यहाँ. But prototype I'm telling you. ठीक है? चलो, the last one is the sporotrichosis, the fourth. So we have seen mycetoma, we have seen chromo, we have seen rhino, and now I'm teaching you the last one here, the sporotrichosis. The subcutaneous will be done. And then we will move to the next category. ठीक है जी? So let me complete the last one, sporotrichosis. Let's start sporotrichosis quickly. अच्छा, है ना? It also occurs via thorn prick, है ना? लेकिन thorn prick किसी भी flower का नहीं, rose का thorn, है ना? Rose का thorn. So beware while giving or taking roses from anyone. If you have the thorn prick, you can have this disease, है ना? So thorn prick. So I'm concentrating on the thorns, not on the rose. Don't concentrate on the rose. I forgot to put the image, that's why I'm putting a beautiful rose, but with the thorns. So thorn prick. Always remember, it enters via rose thorn prick. So you can get a question will be starting like that, a rose gardener. So it occurs in the rose gardener specially. It can occur in the gardener specifically, rose gardeners. So rose thorn prick you can write down if it is not written. Acha, sporotrichosis is the name of the disease. Who is the causative agent? Causative agent कौन है? It is Sporothrix shanchi. बोलो एक बार. Sporothrix, देखो उसका सरनेम कितना बढ़िया है. Shanchi. Pronounce करो. Very interesting. Sporothrix shanchi. Please identify in the option. है ना? बोलना नहीं है, learn नहीं करना है, spelling नहीं learn करना है. Just identify in the option. उतना कर लो कि भाई option में देख के पहचान लें. So it is Sporothrix shanchi. ठीक है ना? So it enters. Listen. From whatever point it enters in human body. See, whatever point it enters in human body, number one, it produces a ulcer there. It produces ulcer, thorn prick say. It is entering via thorn prick. So whatever point it enters in human body, it produces a ulcer. Maybe the hand, maybe the finger, maybe the leg, maybe the foot, whatever. Chalo, it produces ulcer there. After that, it enters in lymphatics. Very unique. It enters in lymphatic and travel along the lymphatic. And at certain distances, it produces multiple ulcers. It is known as series of ulcer. So basically, it produces a series of ulcer. Very unique. No other fungus do so. It produces a series of ulcers, one by one. 1, 2, 3, 4, 5, multiple ulcers along the lymphatics. Say the complete thing. It produces a series of ulcer along the lymphatic. That is sporotrichosis. This is known as lymphocutaneous sporotrichosis. A series of ulcer. Write down this word. Series of ulcer along the lymphatic. Write down. If I have not written, please write down. Series of ulcer along the lymphatic. This is sporotrichosis, very unique presentation. Hannah. And if you take the biopsy here, biopsy is very unique. What is the biopsy here? The biopsy shows the star. Can you see? The stars, beautiful star. Star-like morphology. Can you see? This is star with a central hole, you can see. Hannah, you have heard the word astrology. What is astrology? The study of star. Hannah, these are known as asteroid body. Asteroid means star. I'm correlating. Hannah, asteroid means star. Hannah, so it's star. Asteroid body. Have you seen a cigar? Hannah, cigar. Cigar ka transverse cut is like this only. Cigar. Not the longitudinal. I'm showing you the transverse cut. So also known as cigar body. So either you say asteroid body or you say cigar body, it's one and the same. है ना? यहाँ पे भी you can appreciate the stars. Appreciate the stars. So say the two names, asteroid body, cigar body. Say. So this is the thing. So what we have learned, we are done with all four fungus, by the way. What we have learned this. Can you see? We have learned this. Can you see this? So we have seen asteroid bodies. Can you see the stars? They are seen in sporotrichosis. We have seen the copper panies, also known as sclerotic bodies. These are seen in chromoblastomycosis. And we have seen the spherules containing multiple endospores. It is seen in rhinosporidiosis. These are your questions, PYQs, repeated multiple times, either in the theory form or in the form of the IPQ. Everyone, you can't afford missing this. Repeated question. Say people say, respond, say something. Appreciate my efforts. ठीक है ना? Read the question, tell me the answer. Asteroid bodies are seen in, asteroid are the stars. So stars किसमें होते हैं? The stars are seen in, what's the correct answer? What's the correct answer? Yes, the correct answer is sporotrichosis. Absolutely correct. It's sporotrichosis. Very good. है ना? Asteroid bodies, also known as cigar bodies. Asteroid cut करके, if I use the word cigar, still answer is same. It is sporotrichosis. Read the question. Chalo, read the theory question. There is a gardener. Chalo, first clue I got gardener. Whenever a gardener come in the question, na, my mind thinks about the thorn prick. So there can be a fungus which is entering from the thorn prick, having multiple vesicle on the hand and multiple eruptions along the lymphatic. Along the lymphatic, multiple ulcers, multiple vesicles, multiple eruptions. So it's a typical presentation of sporotrichosis. The causative agent is Porothrix shanchi. Porothrix shanchi. So here also the correct answer is it. I hope everyone is done. Everyone is clear. Can we go ahead? Say yes, people. Can we go ahead? Can we go ahead? I want to show you a chart. You have to give me a minute. And I have to share on the Telegram. A comparative chart, I forgot to put it here. I'm having in another PPT. If you give me 1 minute, I will open that PPT. Just a second. Just a second, I'm just sharing. If I get it very quickly. I guess I got it. Let me open. Let me share on the Telegram and open on the system. So we are done with 4 superficial mycosis, and we are done with 4 subcutaneous mycosis also. Say yes, we are done with 4 subcutaneous mycosis now. Are we done? The 4 subcutaneous mycosis? Just a second, done. I guess I want to show you this. Can you see? Can you see? Now, you tell me. So these are the 4 subcutaneous mycosis. Beautiful diagram. Just see it. Just learn it. You get question on this only. If you have your pictorial memory, now take a snapshot. Not in your mobile, in your mind. Hannah, you get all the questions of the 4 fungus from this. Either image-based question or clinical question, whatever. So I taught you 4 subcutaneous fungus: mycetoma, chromoblastomycosis, rhinosporidiosis, sporotrichosis. Say yes, Hannah. So see the clinical presentation. See the biopsy of each of them. So mycetoma, have you remembered the triad? Have you remembered the triad? Tumor-like lesion, multiple discharging sinus, having granules in the pus. Please don't forget it. Either a description or an image will come. And I forgot to tell you, you can write if you wish, on biopsy. I forgot to tell you the biopsy there. Please add it. On biopsy, you will get sun ray appearance. It is known as sun ray. Sun ray. Hannah, this is the fungus. Can you see the fungus, the filamentous fungus? Hannah, it's looking like the sun ray. The bacteria also are filamentous. Yesterday I taught you the bacteria, na? Kaun sa bacteria? Actinomycetes. I told you 2 bacteria are there, Actinomyces and Nocardia. If you remember, I told you both of them are filamentous bacteria. Yaad aaya kya? I told you that these bacteria look like fungus, but they are not fungus, they are bacteria. Yaad aaya kya? So in Actinomycetoma and Eumycetoma, both of them, the appearance is known as sun ray. Sun ray appearance. है ना? How do we draw a sun? We draw sun like this. Na? Sun bana hai? My kid draw the sun nowadays. So it's like this. है ना? The sun ray appearance. So this is looking like the sun. Sun ray appearance. Got it? So please learn the sun ray appearance. Very peculiar. It's sun ray appearance in both. Yes, Elizabeth. So whether it is Eumycetoma, Actinomycetoma or Botryomycetoma, learn sun ray appearance. The second is chromoblastomycosis. Learn the verrucous lesion. You can't afford missing verrucous word. Verrucous. See the presentation here, see the presentation here. Absolutely different. See the biopsy here and see the biopsy here. Here we get copper panning. Here we get copper panning or sclerotic body. Here we get copper panny or sclerotic body. Can you see it? Let me open this also. Okay, can you see it? The third is the polyp, rhinosporidiosis. It always present with the polyp. And see, the biopsy show the spherules having multiple endospores inside that. Last is porotrichosis having multiple ulcers along the lymphatic. And the biopsy show asteroid body or cigar body. Asteroid or cigar. What do you say? See the 4 presentation and see the 4 biopsy. Absolutely different. Your 100% questions will be based on this. Now, whether it will be a clinical or image-based question, I don't know, but question will be based on this. Got it? Can we go ahead? Haan bolo. Everyone is done. Okay, so let's come on our old PPT again. So can you see this? Anna? So we are done with this, I guess. Okay, so before going to the next 4 fungus, we are done with 8 fungus till now. 4 plus 4, 8 more to do. So जितना time लगा है उतना ही और लगेगा. 8 plus 8, total 16 are done. Okay. So before going to the next, let me tell you something. Don't be busy. Be productive. बहुत छोटी सी line है, but बहुत बड़ी है. Just think about that. Most of the people think that they are giving 15 hours for the study, 16 hours, 17 hours in a day, 10 hours lecture, then 5 hours self-study. So, ठीक है, you are very busy. But what is your productivity at the end of the day? Whatever you are learning, have you retained that? How much is your retention when you are sleeping, when you are going to sleep? So whatever you have read today, if the question is coming from that topic in your exam, will you be able to solve that? 100% you are sure. That is the productivity. So don't be always busy, but be productive. Whatever you are reading, learning now, make sure that you will apply this knowledge in the exam. Anyways, let's move to the next four fungus. We are done with the superficial mycosis. We are done with subcutaneous mycosis. Now it's time to move on the systemic mycosis, the next 4 fungus. So here I'm going to teach you the 4 fungus: histo, blasto, coccidio, paracoccidio, in the sequence only. So page number 17, I guess, right? So I suggest you to open page number 17 of the charts. I know it's very small fungus. These all are systemic fungus. These were superficial, means they were involving the dead skin. These were subcutaneous, they were involving the subcutaneous layer. And now the fungus is deep in the blood. Now, let me tell you, in the systemic mycosis or in the deep mycosis, systemic or deep mycosis, I'm going to teach you 4 fungus: histo, blasto, coccidio, and paracoccidio. They all are deep, means they will be remaining in the blood. They will come in the blood, and from the blood, they will involve multiple organs. That is the meaning of the systemic or deep. The point is that how does they all enter in human body? The route is common. They all enter via inhalation route. You can write somewhere. I have not written this in the PPT. I'm explaining now. You can write this point, that these all 4 enter via inhalation route. Inhalation. They first involve the first organ, lung. So via inhalation, they all will go in lung. So first organ involved is always lung in all 4. Now, if you have chart in your hands, if you have charts in your hand, see the symptoms. Symptoms wala column hoga na, clinical feature wala column. So see the clinical feature column in all 4. The first thing is pulmonary in all 4. Highlight the word pulmonary. That's what I mean. The first organ is always lung. Have you got, Elizabeth? Have you got the pulmonary? Have you got it? Say yes. Just a second, So yes, pulmonary is the first organ. After that, it goes in blood. And after that, from the blood, it goes to the multiple organ. In the clinical feature, you can see the other. And after pulmonary, learn the second organ in each of them. Don't learn all. Just learn the second, extra pulmonary. So you will not get a question on pulmonary on the 4. Everyone knows the first organ is always pulmonary. They cause the pneumonia. After pulmonary, what are the extra pulmonary organs? Usme bhi pure yaad nahi karna hai. Learn the second organ of all 4. That's it. So this is the clinical feature. I'm not going to teach you clinical feature. मैंने एक बार में सबके बता दिए. So let's start the 4 fungus one by one. Start with histo. Histoplasmosis. Who is the causative agent? What I have written causative agent? See, ma'am, histoplasma. Histoplasma capsulaticum. Have I written this word? Capsulaticum. In your notes, is it written? If it is not written, write down. Capsulaticum. This is the causative agent. जहां पे भी लिखा है ना, write down it's a misnomer. It is not a capsulated fungus. So you feel like it's capsulated, मतलब इसमें capsule होगा? No, it's a misnomer. It don't have any capsule. So please write down it's a misnomer. It don't have the capsule. Wherever capsulaticum is written, write down it don't have capsule. It's a misnomer. It was one question once a time. So please learn that. Learn the other name. Histoplasmosis is also known as Darling disease. Very beautiful name. Why Darling disease? Because it was discovered by a scientist. The name of the scientist is Samuel Darling. That's why, to honor the scientist, we named the disease as Darling. So it's also a PYQ and FMG only. What is Darling disease? Answer is histoplasma. It's also a question, which of the following organism is non-capsulated? वन ऑफ द ऑप्शन इज हिस्टोप्लाज्मा कैप्सुलेटिकम. तो बच्चों को लगा कि भाई कैप्सुलेटिकम तो होगा ही. नो, इट्स अ मिसनोमर. कैप्सुलेटिकम इज नॉन कैप्सुलेटेड. प्लीज लर्न, है ना. चलो आ जाओ बायोप्सी पे. क्लिनिकल फीचर्स आर नॉट टीचिंग यू. लर्न. फर्स्ट इज पल्मोनरी, सेकंड ऑनवर्ड्स यू कैन लर्न, है ना. So this is the thing. Direct microscopy, if you do, see what you get. Number one, it's always inside the macrophage. It's always inside the macrophage. है ना? It's not outside the macrophage. It's intracellular histoplasma. It's always inside the macrophage. ठीक है? This is the nucleus of the macrophage. Now inside the macrophage, can you see? This is histoplasma. This is histoplasma. It's budding. It's budding. है ना? Here also it's budding. So this is histoplasma. It's budding. It form a bud. The base of the budding is narrow. Highlight the word narrow, narrow, narrow. Where is the word narrow? Narrow based bud. Achha. Why I'm highlighting the word narrow? The first fungus I'm teaching you histo. What is the next fungus I'm going to teach you after this? What is the next one? Manoj, Reena, what is the next? It's blasto. After that I will teach you coccidio, paracoccidio, wo theek hai na? Histo and plasma, blasto, both of them are similar, है ना? This is also budding. This is also budding. But see, I'm drawing the two buds. This is a bud here and this is a bud here, है ना. Appreciate what you have to appreciate. The base here, it's narrow, and appreciate the base here, it's broad. It's broad. That is the only difference between histo and blasto. The only difference. The narrow base budding, say narrow base budding and broad base budding. Narrow base and broad base. Please learn. Please understand meaning of the narrow and broad. Say yes. Huh? Say yes. Everyone say yes. So this is narrow, this is broad. Narrow base, broad base. Narrow base is histo, broad base is blasto. There is one more difference between the two, histo and blasto, the biopsy feature. I told you this one is always intracellular. So it will be inside the macrophage. This is a macrophage and you get multiple histo. It is not always intracellular. The second one, blasto, is not always intracellular. It can be, it cannot be. It is having double wall. Here we are having double wall. Apart from the narrow bud and broad bud. Okay, narrow bud and broad, yes. So a very good, Elizabeth. Elizabeth is giving a mnemonic B for B. You can learn. Blasto for broad. So you will not forget कि blasto में broad है. Histo is narrow. है ना? You can also learn कि histo का H ऐसे लिखते हैं ना, और narrow को ही आप ऐसा H बना लो. So you can learn like histo is narrow and blasto is broad. You will not forget. Say yes. Everyone say yes. अच्छा जो हम 1 2 3 4 5 6 7 8 लिखते हैं. 1 2 3 4 5 6 7. How do you write 8? हाँ जल्दी जल्दी में everyone write like this. We all write like this 8. But it is not the way to write the 8. 8 is written like this. Ideally, 8 is written like this. I don't know, have you seen 8? हम ऐसे लिखते हैं digital. 8 is written. So which of them is figure of 8? This one is figure of 8 or this one is figure of 8? This one. So blasto का दूसरा नाम है figure of 8. The blasto name is figure of 8 because it looks like it, because of the broad base. It looks like it. Say yes, people. Say yes. This is not figure of 8. तुम बोलो कि मैम ये भी तो 8 ही है ना, ये भी तो 8 ही है. मैं भी ऐसे ही बोलती थी, है ना. But someone told me कि 8 is like this, है ना. So this is like this. Okay जी, figure of 8 is blasto, not histo. Okay, चलो proceed. So I'm teaching you histo right now. Histo में हमने देखा the other name is Thomel Darling. So it is known as Darling disease, है ना. It is not capsulated. Histoplasma capsulaticum but not capsulated. Direct microscopy पे it is intracellular. The first thing, it is intracellular. Inside the macrophage, highlight the word macrophage, inside which the yeast is there, which is narrow budding base, है ना, narrow budding base. So that's it. Read the question, tell me the answer, people, quick. जरा जल्दी बोलो आंसर, जरा जल्दी बोलो. What is the answer? Darling disease, obviously histoplasma, है ना, Darling disease. ठीक है, चलो. The next is blasto. Learn the other names of the blasto. Blasto occurs only in North America, nowhere else in the world. Only in North America. You know, Chicago is in North America. It is there. And Gilchrist is also in North America. It is there. So please learn the three names. North America, वहीं से याद आता है मुझे Chicago, और वहीं से याद आता है मुझे Gilchrist. Gilchrist, है ना? So these all things are same, है ना? North America में ही Chicago and Gilchrist है. So it is known as North American blastomycosis, Chicago disease, and Gilchrist disease. Learn the other names. Please learn. You get questions on North American blastomycosis. ठीक है? चलो. The causative agent, if you want to learn, you can learn. ये तो disease का नाम है. Causative agent है blastomycetes dermatitis. ठीक है? If you want to learn, you can learn. Direct microscopy पे I already told you. So it is also budding yeast. It is also budding yeast, but broad base. Highlight the word broad base. You can appreciate the base here. Appreciate the base here. Appreciate the base here. Not only it is thick walled, it is double walled. Highlight the word, it is double walled also. है ना? In the real image, you can see it is double walled. It is figure of 8. है ना? It is known as figure of 8. Appreciate the word figure of 8. I have already told you. Read the question, tell me the answer. The question is not very good. I don't like this question although. Read. So histoplasma image is given belongs to which fungus? What do you say? Is it blasto or histo or coccidio or paracoccidio? What do you see in the image? In the image, you can see the budding yeast. Hannah, if you see the buds are relatively broad base, number one. Hannah, broad base. The double mold is not visible, but they are not intracellular. So I will prefer blasto over histo. अब दिखने में तो histo भी ऐसा ही है ना, लेकिन histo is intracellular. This is extracellular and it is looking like broad base. अब आप बहुत broad और narrow इतना तो नहीं समझ में आ रहा, but still blasto is more preferred than histo. So correct answer here is blasto. Okay, ji. Chalo. The next is the coccidio, the third one. So we are done with histo, we are done with blasto. The third one I am coming is coccidio. Coccidio, learn the other name. It occurs in California. In California. In California, there are many valleys, there are many deserts. That's why desert rheumatism, valley fever, one and the same thing. Learn California. California में तुम्हें पता होगा ना, California is a city of valleys. So that's why it has valley. It is having many deserts also. So valley fever, desert rheumatism, California fever, one and the same thing. Learn the other names. Hana, the causative agent is coccidioides, coccidioides immitis, या coccidioides posadici. They will not ask the causative agent. Hana, microscopy is spirule. और कहाँ पढ़े spirule? और कहाँ पढ़े जी spirule? Where you have read the spirules. One more place, rhinosporidiosis. यहाँ पे भी same spirules हैं. The spirules contains hundreds of endospores inside that. One spirule contains hundreds of endospores inside that, the spirules. The last one is the paracoccidiomycosis. The last one is the paracoccidiomycosis. It is known as South America blastomycosis because it occurs only in South America. The blastomycosis was in North America. This is in South America. And now you can see the causative agent. Microscopy pe, you will get again budding yeast. But budding is very peculiar. Have a look on the screen. Can you see? This is a yeast. Everyone see. This is a yeast. See the two small buds. Two small buds. I know. Small buds. It is looking like Mickey Mouse. Is it a Mickey Mouse? A cute Mickey Mouse. Hana? So this is known as Mickey Mouse appearance. What it is known as? Mickey Mouse appearance because of the two small buds here. And if multiple buds are there, not two. If multiple buds are there, this is known as pilot wheel. It's look like a wheel. Pilot wheel. So learn the two appearance. Mickey Mouse, pilot wheel. Mickey Mouse, pilot wheel. See the real image of pilot wheel. So this is the real image we are done. We are done. So let me show you. I want to show you a chart again. Okay, just a second. Give me a minute. I want to show you the same chart comparing of all these four together. I forgot to put in this PPT. No? I guess this one. No, not this one. I guess it's there. It was this one. Okay, can you see this? Can you see this chart? Huh? So I've already taught you the four. Hannah. So we are done with the four. These four. Can you see it now? These four are your this thing. What do you say? The deep mycosis. The first thing, they all enter in human body via inhalation. You have to learn. They all enter in human body via inhalation. The first organ is lung, and after lung it is blood, and via blood it spread everywhere. Hannah. So histo, I can see the budding yeast, but a narrow bud, narrow base, and it is intracellular. It's intracellular. In blasto, I can see figure of 8. So I can see a broad base. In coccidio, I can see a spirule. And here I can see either the Mickey Mouse or the pilot wheel. Say yes. The first organ is lung in all of them. Don't learn the mold form. The yeast form is okay to go. Mold form ko learn karne ki zarurat nahi hai. Say yes, people, say yes. Hana, this is how we go. So let's come on our old PPT only. Hana, and continue with the last four fungus. The last four fungus. So 12 fungus are done till now. Is it easy going till now? Everything is chill. Zyada burden to nahi aaya. So we are done with the four superficial. Comparative table is the best way to learn. Otherwise you can't learn. The four superficial done, the four subcutaneous done, the four systemic done, and now the last four opportunistic. So let's start the last page, 18, page number 18 of your chart. Hannah? So the last four fungus I am teaching you, and the last 15 minutes we will pack mycology. So let's come on the opportunistic fungus. What are opportunistic fungus? The opportunistic fungus are the fungus, they do not cause disease in the healthy individual. They cause a disease in immunocompromised individual. That's why these are known as opportunistic mycosis. Okay, ji, है ना, opportunistic. So let's start the opportunistic mycosis. इसमें I'm going to teach you four, one by one. So start with Candida, then Crypto, then Zygo, then Aspergillus. So start with Candida. The first I'm teaching you here is the Candida. Candida is the most common fungal infection in human. Most common fungal infection in human. Please learn whether it's HIV or non-HIV. The most common fungal infection in human is Candida. Okay, Candida. How many types of Candida you know? Candidiasis is a disease. By candidiasis तो disease है ना? Tell me the causative agent. You will say, ma'am, Candida. Which Candida? So there are many type of Candida. Candida tropicalis, Candida gallbrata, Candida krusei, Paraphilus, है ना? Dubinensis, Vishwanathi. There are many Candida, right? There are many Candida. Okay. Okay, so there are many Candida you can learn. All these are the causative agent. These are the Candidas. Okay, where does the Candida come in this classification in the morphology? I told you at the starting only. The people who have joined late, they may not know. Candida is the only fungus. It is yeast-like. Yeast-like में एक example है Candida. मैंने चिल्ला चिल्ला के बोला. So it is the only fungus where you will get the pseudo-hyphae. You know what is pseudo-hyphae? It's not a true hyphae. It is the constrictions. This is pseudo-hyphae. So Candida is the only fungus which will have pseudo-hyphae. So whenever you get pseudo-hyphae word in your question, mark the answer Candida. Hai. So you can say, ma'am, it's yeast-like, and that's why it is having the pseudo-hyphae. What are the clinical features it causes? It causes 4 types of clinical features. Invasive candidiasis, it involves all organs of human body. It can involve any organ. It can cause meningitis also, encephalitis also, hai, or esophagus also, mouth also, ears, हर organ, technically any organ में हो सकता है. So कोई भी question आ सकता है. It is not fixed कि मैं एक particular organ बताऊं. Got it? Mucosal में the oral thrush is there. In the oral cavity and in the vagina, the thrush is there, whitish thrush. It is known as thrush, the white thrush. Cutaneous means skin is involved or allergic. So 4 type of Candida is there. Lab diagnosis. Lab diagnosis, direct microscopy में you will get the yeast and the pseudo-hyphae. Basically, these are yeast-like. See. You all can see these are the yeast. But what you can see, I'm drawing a structure. See, I'm highlighting a structure, I mean. Can you tell me what is the structure I'm highlighting? Can you tell me what is the structure I'm highlighting? Can you tell me what is the structure I'm highlighting? Wherever arrow is there, I'm highlighting a structure. I can see it's looking elongated, but actually it's pseudo-hyphae because constrictions are very clearly visible. Please appreciate the constriction. Prabingal, Elizabeth, everyone. Pseudo-hyphae constrictions are there. So whenever this image come in your exam, it's Candida. So I can see the bud yeast which is budding with the pseudo-hyphae. You can understand that. So pseudo-hyphae word is very important. So direct microscopy, learn one word, pseudo-hyphae. You always get pseudo-hyphae. The budding yeast with the pseudo-hyphae. Coming on the culture on SG agar, cream colony. Nothing important. It will not come. It is having the cream colony. You can appreciate the cream color colonies. So it is having cream white smooth colonies. SDA. And the last, the third one, test for species identification. What do you mean by test for species identification? What do you mean by test for species identification? It means there are many type of Candida. Candida albicans is the most common. Candida. Apart from that, we have many other Candida. So how should I differentiate Candida albicans from others? This is species identification. Most important Candida is Candida albicans, where it is written Candida albicans. Candida albicans. Rest all are less important. So I want to differentiate albicans from others. Uske liye I'm having 3 tests. For species identification, I'm having 3 tests. See the 3 tests I'm having. Number 1, germ tube test. Number 2, Dalmau plate. And number 3, chrome agar. I will explain all 3. So let me come on the germ tube. You get many questions on germ tube. Germ tube test. Also known as Reynolds-Brown phenomenon. Because the scientist who discovered it is known as Reynolds-Brown. So germ tube test also known as Reynolds-Brown phenomenon. See what you have to do. Take your Candida. Take your species. I mean, this is my fungal species, my specimen. And it contains Candida. I know that because I have seen the pseudo-hyphae. Iske andar on direct microscopy, I have seen the pseudo-hyphae. So I'm sure it's Candida. That is not a concern. It is Candida. I'm 100% sure. But I want to know whether it is Candida albicans or other Candida. I want to know that. Whether it is Candida albicans or other Candida, I want to know that. So what I will do, I will mix the sheep serum in this. Sheep ka serum. Human or sheep ka serum. Human or sheep ka blood. And I will mix in the specimen and I will incubate it for 2 hours. After that, I will make a smear. So if it is Candida albicans, so Candida albicans in presence of human serum या फिर sheep serum, उसमें से tubes निकल आएंगी. Tubes will erupt out. The tubes, these are known as germ tube. No other Candida have the tube. This is known as germ tube experiment. So if the tubes are coming after 2 hours, it is Candida albicans. If the tubes are not coming, it is any other Candida. We don't know which one, but it is not Candida albicans. So this is how we differentiate Candida albicans with others. So germ tubes are formed. It is positive only in one Candida albicans. Say yes, people. समझ में आया क्या जर्म ट्यूब क्या है? टेक योर स्पेसिमेन in which you are sure it's a candida because the pseudo hyphae is there. So it is not a diagnostic test. Diagnosis is already there. It is species identification, whether it is candida albicans or others. I want to know that. So I will mix the serum. What I will do? I will mix the serum. Whose serum? Sheep serum or human serum. And after 2 hours, I will incubate. After 2 hours, what I will do? I will make a smear. In the smear, if candida albicans is there, I can see many of them, the tube has erupted out. This is known as germ tube experiment. It is present only in albicans, not others. Germ tube experiment, also known as Renault Brown. इससे बड़ा क्वेश्चन आता है. So this is how we differentiate the albicans from others. Germ tube experiment. Okay, G, everyone got? One more experiment is there, also known as Dalmau plate. Dalmau plate यानी corn meal. Do you eat corn? भुट्टा बोलते हैं हिंदी में. I love corn. हाँ, corn पसंद है तुम्हें? Candida albicans को भी बड़ा पसंद है मेरे जैसे, है ना? So Candida albicans love the corn. So what do you take a SD agar, है ना? Simple SD agar. Add corn in that. Corn meal. Corn meal commercially available, है ना? आपने घर का भुट्टा मत ले जाना. Corn meal commercially available. So it is known as corn meal agar. So it is known as corn meal agar. It contains the corn meal, है ना? And try growing Candida in that. Whatever Candida you have. I'm not sure whether it is other Candida or Candida albicans, but it is Candida, I'm sure. So try to grow the Candida on your corn meal agar, not on simple SDA. Try to grow on corn meal. If it is Candida albicans now, after eating the corn, it will convert into chlamydospores. The Candida will convert into chlamydospores. Other Candida will not convert. So this is known as Dalmau plate. Dalmau से क्या याद आना चाहिए? Corn meal. Also known as corn meal agar experiment. Corn meal agar experiment. So by this, the two experiments we can sure whether it is Candida albicans or others. And the third and the last is chrome. Chrome का मतलब ही होता है colors. So it's the agar which give different color to different Candida. Different colors. So based on the color, you can, I don't know the exact coding that which color means which Candida, but different colors have different Candida. So based on the color, you can identify which of them is Candida albicans. So there are 3 ways to differentiate albicans from others. It is known as species identification. Species identification. What are the 3 ways, people? I'm trying very hard to explain you. Okay? What are the 3 ways? The first is germ tube experiment. Germ tube experiment, also known as Renault Brown experiment. Okay? Second is corn meal experiment. Corn meal experiment, also known as Dalmau plate experiment. And third is chrome. Chrome matlab color, and you got it, है ना? So shall I repeat or you got it? What we are doing? So this one is positive only in Candida albicans, not others. The tubes will erupt. This one is also positive only in Candida albicans, not in others. I mean, the Candida albicans convert into chlamydospore, and chrome में different colors. Okay, so this is the Candida. Read the question, tell me the answer. We are done with Candida. चलो fast. Okay, चलो बोलो जल्दी बताओ. So read the question. There is a patient. Take the clues. Okay. Age is not given. Gender is not given. There is a patient having dysphagia. What is dysphagia? Difficulty in swallowing. Dysphagia. So there may be some problem in the esophagus. Endoscopy shows esophageal candidiasis. Have I taught you Candida can occur in any organ from head to toe? It is in esophagus. It can be anywhere. It is an invasive candidiasis. Okay. The esophagus is involved. You don't have to make the diagnosis. Diagnosis is given to you. It's Candida. Hana? The organism was sampled and cultured on a special media. We don't know special media. The image of which is given to you. Special media, some special media we don't know. Which phenomenon is shown? So in the image, what you can see? In the image, I can see small yeast are there. From that, some tube-like structure is coming out. Some tube-like. Appreciate the tube-like structure. So basically, it is a germ tube experiment we are conducting in Candida. The diagnosis is given to you, Candida. So my answer is germ tube experiment. Okay, so this is the way we deal with the question. The correct answer is A, and you all are correct. Very good, है ना? So you get question on pseudo hyphae also. मैंने वो question डाला नहीं है, but you frequently get question on the pseudo hyphae. So coming on the second fungus, we have to study 4, last 4. उसमें से एक हो गई, 3 more to go. 3 more to go. So the second is the cryptococcus. I'm teaching you cryptococcus, है ना? मैंने 16 fungus पढ़ाई ना, तो 16 I will teach you total today. 4. Cryptococcus is the only capsulated fungus. Cryptococcus is the only, so learn, it is the only capsulated fungus. The capsule is made up of polysaccharide only, like all capsules. So yesterday I taught you capsulated organisms. How many capsulated bacteria you know? 9. बोल के मैं थक गई. कितने होते हैं? 9. Yes, very killer bacteria have pretty nice capsule. है ना? B double होता है. So if you say the bacteria, they are 9. And if you say मैम all organism, तो C को भी double कर दो. है ना? C को भी. One is Clostridium and one is this तुम्हारा क्रिप्टोकोकस. So total 10 organisms. मैंने वहां भी बताया था. 9 bacteria हैं, 1 fungus, total 10 organisms. 9 plus 1. Yes, yeah, told you. So cryptococcus is the only capsulated fungus. Please learn. Based on the capsule, it is of 4 types. जब भी capsule आए तो types बताओ, A, B, C, D. है ना? It is of 4 types. Based on the capsule, it is of 4 types. So for diagnosis, we do negative stain, India ink. For all capsulated organism, we do India ink. ना मैंने बताया होगा. Whenever I taught you India ink, negative stain, in which we stain the background, not the organism. You can see the organism is standing out. The organism is standing out in the black background. You can see we are staining the background, not the organism. So negative stain is done for the capsulated organism. So diagnosis किससे करते हैं? Negative stain से. बस इतना ही है. Candida में 2 चीज याद रखना है. It is capsulated fungus. Based on the capsule, it is of 4 type A, B, C, D. A most common होता है ना? And उसको demonstration के लिए we use negative stain. Negative stain is India ink or Negrosun. Okay, got it? बस ये 2 ही चीजें आएंगी. So read the question, tell me the answer. The image given below is of which organism? Can you identify the organism? The image given below is of which organism? So obviously you can see here all 4 are fungus, and in the image I can see the image is negative stain because the background is black but the fungus is not black, and I can see the capsules very well. These all are capsules. These all are capsules. I can see the capsules very well. So this one is Cryptococcus. This one is Cryptococcus. It is a capsulated fungus. Okay, the last 2 I am teaching you together now. So we are done with Candida. ठीक है, we are done with क्या पढ़ा है अभी? Cryptococcus. The last 2, Zygomycosis and Aspergillus. ठीक है, Zygomycosis and Aspergillus. So let me give you an overview of the 2 together. फिर हम डिटेल देखते हैं. Zygomycosis and Aspergillus. ठीक है, Zygomycosis and the last one is Aspergillus. So I mean, you will get other features also. No, it is not the thing they will give you just image. In the options you have to see other clinical features also, है ना? So carom coin appearance was there on the blood agar, if you remember. This is direct microscopy. वो blood agar था, agar पे carom coin था. यहाँ पे ये carom coin नहीं है. It's a capsule which is the negative background. वहाँ पे blood agar पे था. They are absolutely different. है ना? Looking wise you may be thinking कि same है ना? लेकिन question will be not like this. ठीक है, चलो. Zygomycosis, Aspergillus. ठीक है जी. So let me tell you the last 2 fungus. Zygomycosis में there are two zygo, है ना? So यहाँ पे आएगा 2 fungus आएंगे, एक mucor और दूसरा rhizopus. These 2 fungus come under Zygomycosis. Aspergillus में there are 3 type of Aspergillus. Aspergillus fumigatus, है ना? मैं पूरा नहीं लिख रही. Aspergillus flavus, है ना? और Aspergillus niger. So there are 2 type of zygo, 3 type of Aspergillus. पहली thing. The second thing, both of them are molds. Heard my word? So check the classification. जहाँ पे mycology start हो रहा है ना? I told you 4 type of fungus: yeast-like, mold, and dimorphic. Check in the mold. Mold are elongated. Some of them are septate, some of them are non-septate, aseptate. Have I taught you? So both of them are molds. You can check there. In the classification, I have told you Zygo B, Aspergillus B. It will be there. Zygo में mucor I have written, है ना? Aspergillus. Both of them are molds. So let me draw out the diagram of both. So let me draw the diagram of Zygo. It is a mold like this. Let me draw, then I will explain the differences between the 2. You have to learn basically the differences between the 2. ठीक है? Learn this, and here it's like this. You will tell the difference. है ना? 3 differences are there. You will tell the difference. See the diagram of the both. Beautifully I have drawn. If you wish, you can also draw. Number 1, you will say कि broad. Here the hyphae is broad. See the hyphae. And here the hyphae is narrow. Say, ma'am, broad hyphae. Write down broad hyphae. Write down narrow hyphae. Say yes, broad hyphae, narrow hyphae. Number 1. Number 2, see the angle of the branching. Here the angle is obtuse or it is broad. Here angle is typically 45 degree or acute. 45 degree or acute. So angle is also broad. Hyphae is also broad. Angle of branching is also obtuse or broad. Here the angle is acute branching, or you can write 45 degree in the bracket for just for learning. They are typical. दिख रहा है मेरे पीछे है. So these are typical 45 degree. Please learn, है ना? These are 45 degree. And the last difference, this is aseptate. There are no septa. This is aseptate, है ना? यहाँ पे septa मुझे नहीं मिल रहा. This one is typically septate. You can see the septate. I'm giving you time. If you want to draw, please draw. You get question on this only. बस ये 3 difference. See the 3 difference. This is zygo. This is Aspergillus. Okay, ji, got it? Huh? Yes. So please learn the 3 differences. You have drawn? Can I flip this page? Have you drawn? Say yes. Can I flip this page? It will not come again. Can I flip? Show you the theory? We are ending mycology fast. Okay, everyone is okay. Okay, let me flip that. Okay, so zygomycosis. We have seen these are aseptate number one, है ना? And there are two fungus here, rhizopus and mucor. Rhizopus and mucor. Clinical feature mucor का. Rhizopus important नहीं है, mucor का clinical feature. You may be have seen ना, अभी कोविड में पोस्ट कोविड सबसे बड़ा कॉम्प्लिकेशन क्या आया कोविड में? पोस्ट कोविड मोस्ट कॉमन कॉम्प्लिकेशन इज द फंगल इन्वॉल्वमेंट ऑफ द आई, है ना? Orbital cellulitis, and the fungus was entering in the brain. You may have many cases. We have seen many cases in our hospital because in COVID, what we give the treatment? In COVID, we give the treatment as steroid, long courses of steroid. Because of the steroid, there is immunosuppression. And immunosuppression is there, and these are opportunistic fungus. They occur in immunocompromised people, not in healthy people. So after the COVID, most common fungus is mucormycosis. Mucormycosis is involvement of the orbit, most common cause of orbital cellulitis. So ये यहाँ का ये हो गया आपका, I mean the clinical feature, है ना? After that many other organs are also involved, but most common is orbit. Learn the most common organ. Second के बाद ठीक है, but learn the most common organ, है ना? You can see the diagnosis. Diagnosis is direct staining. Can you see where is the fungus? Can you see the black color? Molds. Appreciate the mold. I'm highlighting with red color. See, appreciate this mold. I want you to appreciate this. I want to appreciate the branching also. I want you to appreciate these are non-septate. Appreciate. They are broad. Appreciate the branching. The branching is obtuse. Say yes. And appreciate they are non-septate. I'm really sorry. You can see these are aseptate. These are broad. Okay. And the branching is also obtuse. Okay, Ji. Anna. So that is the thing. Now compare the two. I have already drawn this diagram for you. This one is aspergillus that I'm going to teach you next. And this one is this zygo. Zygo में दोनों आ गए, mucor or rhizopus, है ना? You can appreciate, है ना? The same thing I have shown you there also. You can see the angle here, है ना? You can see the angle here, है ना? You can see this one is broad. You can see these are narrow. ठीक है? You can see यहाँ पे septa बहुत अच्छे तो नहीं दिख रहे, but this one is septate. But clearly this one is non-septate. Okay, जी. So can we go ahead, है ना? So you can see the differences. Okay, culture you can learn. So you may ask, ma'am, how to differentiate rhizopus and mucor? Both of them are zygo. We got it. Both of them morphologically like this. Zygo भी यही है, mucor भी यही है. That microscopically you cannot differentiate the two. But on culture, on SDA, you can differentiate. So you can see both of them are SDA culture. SDA पे culture कर लो. So rhizopus will show salt and pepper. नमक और काली मिर्च कभी mix किया है? White, black. The appearance is white, black like that. Salt and pepper appearance. Learn this word, है ना? And mucor में it is white woolly colonies, only white woolly. So here salt and pepper appearance, and here woolly, white woolly colonies. So based on which you can differentiate the two. We are done. Read the question. Tell me the answer. Which of the following organism is responsible for orbital cellulitis in a diabetic ketoacidosis? Especially diabetic people में more common है ये complication. So of course the answer is mucormycosis, most commonly causing orbital cellulitis. Okay, mucor is the answer. So coming on the last fungus, aspergillus. I have already explained you aspergillus. Aspergillus is of 3 types. I mean there are many types, but 3 are important in our syllabus. So Aspergillus fumigatus, flavus, and niger. Aspergillus fumigatus, flavus, and niger. Direct microscopy I explained you many times. You can see the narrow hyphae, the narrow branching, acute angle branching, and septa. Highlight the three things. Okay, got my point? You can highlight the 3 things. You can see the narrow branching. Okay, you can appreciate the width is also narrow, and you can appreciate this is septate. It is septate. This I have already explained you. Read the question, tell me the answer. Identify the fungal organism shown on the Ghumari stain. So identify. Can you do the identification for me, please? Can you do? You can see the branching is very narrow. Acute angle. And if you see it closely by zooming it, you can appreciate the septa also. And you can see the branching is not. The width is also narrow. So of course, first decide what is it. Is it acute angle or right angle? Of course, it's not right angle. It's acute. So acute में you have 2 options. दोनों में से क्या opt करोगे? Acute में first option is rhizopus, और acute में one option is aspergillus. Obviously, rhizopus is never acute. And it is aspergillus. So answer is C. Based on which we will go with C. Thank you. Thank you so much, Bilal, for the compliment. Thank you. So I hope everyone is confident now. Thank you so much. Okay. So can we move ahead? So we are done with Myco. We are done with Myco. How much time it take? I guess it is nearly 1 hour 45 minutes. So I thought I will be able to complete in 1 hour 30 minutes. Approx we have completed. Okay. Okay, so we have completed entire Myco. We have completed entire Myco, and let me start the parasito now. Okay, so before going to the parasito, let me tell you something. Dreams don't work unless you do. We all dream. We all dream. We all dream. You want to this. You want to do this. You want to do this in your life. We all. But how many of you actually work for your dream? Anna, so dream will come true only when you get up in the morning and start working every day on your dream. Definitely your dreams will come true. है ना? सपने से देखना नहीं होता है, सपनों के लिए काम करना पड़ता है. And have you heard ना कि Abdul Kalam have said a very good proverb. Dreams are not those which we see when we sleep. Dreams are those which make us not to sleep. है ना? जो हमें जगाए रखते हैं वो सपने हैं, जो सोते हुए हम देखते हैं वो सपने नहीं है. We know. Okay, चलो. So let's come. This is annotated one. Let me save the annotated one. I guess it is in continuity. Just a second. So let me start with the parasitology. Okay, so let me start with the parasitology. So are you people there? Full charge up. Can we continue with the parasito? Break I will give you at 12:15. Anna. So maybe around 12:15 or 12:20, like yesterday, we will take a long break till 1:30, the lunch break, whatever break you say. Breakfast plus lunch, the combo break. है ना? तो बड़ा break वहाँ लेंगे. One break only. ठीक है? चलो. Let's complete. Okay, no short break. Let's continue. Now today is the last day. I have to complete parasito. अभी parasito में मुझे 4 घंटे चाहिए. 4 hours active without break. है ना? तो जाके I will be able to complete 4 or 4.5 hour. उसके बाद 1 hour for the pending topic. Pending में sterilization is there and immunity की कुछ topics हैं. So 1 hour. So total 5 active hours. और मैं जितना सोचती हूँ ना उससे ज्यादा ही होता है हमेशा. So देखो यहाँ पे भी I thought कि 1.5 hour लेकिन 15 minutes भी expand. तो मैं 5 घंटे सोच रही हूँ, maybe 5 to 6 hours we require. Active without break. Now you do the calculation. You do the calculation. We will take a lunch break also. We will take small coffee break also. है ना? So till what the class will extend. ठीक है? So I do not want to skip anything. So let's continue ना. क्या break? चलो. I'm comfortable. ठीक है? So why you are not comfortable? You can have a cup of coffee or a tea while watching the lecture. You have the privilege. I don't have that, but you have that. Huh? So you can have a cup of coffee or a tea while watching only. Okay, chalo. So can we continue? Parasito. Yes, you have to continue the parasito like fungus only. So I mean, it's up to you. If you want the elaborative notes, tell me the page number. And if you want the charts, tell me the page number. चार्ट्स का भी पेज नंबर बताओ और इलॉबरेटिव नोट्स जो है लॉन्ग नोट्स जो है मेरे उसमें एंड में पैरासाइट है एंड में आई गेस पेज नंबर 90 ऑनवर्ड्स होगा 90 या कहीं पर होगा लास्ट के 15-20 पेजेस आर देयर सो टेल मी द पेज नंबर ऑफ बोथ ऑफ देम चार्ट में पेज नंबर 2 हियर इट इज पेज नंबर 91 सी माय गेस वाज राइट ओके सो फ्रॉम 91 ऑनवर्ड्स सबसे पैरासाइटो है द लास्ट पैरासाइटो एंड चार्ट में सेकंड पेज फर्स्ट से ही होगा यार सेकंड से तो नहीं होगा फर्स्ट पे क्या है व्हाट इज देयर ऑन पेज नंबर 1 व्हाट इज देयर ऑन पेज नंबर 1 कैन यू रीड द ऑर्गेनिज्म नेम एंटामीबा हिस्टोलिटिका कहां से स्टार्ट हो रहा है दैट इज माइको ओके page number 1 so in the chart start from page number 1 only anatomia histolytica so whatever you want to follow it's your choice I told you now there are two type of students always in my class some follow charts they are very comfortable and happy with the charts whatever extra information they get in the lecture they just write in the chart and they finalize their chart itself है ना but there are some students जैसे कि नहीं हमें elongated से पढ़ना है so they are also there it's up to you so whatever is written here the compact form is given here है ना that's what I'm teaching you so all the three things are synchronized my PPT plus my long note plus my chart everything is synchronized so you will not feel out of that है ना जो फॉलो करना है करो it's your choice ठीक है ओके क्या नहीं सुन रही मैं उस्मान what I'm not hearing मैम सुन ही नहीं रही what I'm not listening I'm listening say Usman or you want to say something so can we proceed write down what you want to say chalo let's start parasitology let me start with the parasitology okay in the parasitology before starting as usual okay so is it compulsory to create a new link we will continue for half an hour more at 12:15 I'm leaving still it is compulsory so after half an hour still I'm going to have a break now So I think I'm allowed to take a 2.5 or 3 hour session on one link. I think. But still, if it is a confusion, the team will call me. Okay, so don't worry, just continue. Chalo, parasitology. So in the parasitology, the first thing you must understand, what is a parasite? Parasite kya hota hai? What is a parasite? You have to understand that. Parasite hota kya hai? Okay, what is a parasite? Okay, parasite is the organism which reside on another organism. Parasite is an organism which reside on another organism for two things. है ना? The another organism is known as host. है ना? The organism which is residing is known as parasite. है ना? So parasite obtain two things from the host. Parasite obtain nutrition, that is food or nutrition from the host, and shelter from the host. So the host is providing two things to the parasite, है ना? एक तो घर खाना, है ना? रोटी कपड़ा मकान. कपड़ा तो नहीं दे रहा है, लेकिन रोटी और मकान, है ना? So roti or makan. So I mean the host is providing the food and the shelter to the parasite. Very good. The parasite is very happy. बदले में parasite क्या दे रहा है to the host? Parasite is getting disease from the host, है ना? The parasite is getting disease from the parasite is giving disease to the host, है ना? So host parasite को दो अच्छी चीजें दे रहा है, food and shelter, और बदले में parasite is giving disease to the host. So this relationship is known as host parasite relationship. Got it? So who's a parasite? Who obtain two things, food and shelter from another organism. The another organism is known as host. Okay ji? Yes, dhokebaj. Very good. Okay, just a second. Just a second. Chalo. Okay, so this is a parasite. There are two type of parasites. What are the two type of parasites? Protozoa, metazoa. सबसे पहले देखना होता है classification. So what is the मतलब criteria for classification? What is the criteria? Protozoa are unicellular and metazoa are multicellular. Metazoa also known as helminth. The metazoas are also known as helminth. Metazoa and helminth एक ही बात है. So I taught you all four classifications till now. What was the basis of classification in bacteria? What is the basis of classification in viruses? What is the basis of classification in fungus? Right now I taught you fungus. And now I'm teaching you parasitology. So what is the basis of classification? The primary thing you should know the classification. If you are not knowing even the classification of these four organisms, you are out of competition. भाई पहली चीज क्लासिफिकेशन तो याद करो ना. जितने ऑर्गेनिज्म है यू शुड नो कि वो कौन सी कैटेगरी में आते हैं. उनसे दोस्ती तो करो, उनके नाम तो याद करो, उसके बाद उन सबकी डिटेल देखो. Micro is very easy if you know the classification of all and if you know the important points of all of them. That's it. It's a study of microorganisms. So what I have done now, a big sheet. All bacteria on one page, on viruses, on all fungus, all parasito. Write down the classification and write down the important points there only, whatever is important. So this is a way on one big sheet we can entirely compact the microbiology in this way. Got my point? Chalo. Listen, the bacteria are divided into four categories based on gram staining. Gram positive cocci, gram negative cocci, है ना? You know already, gram positive is like gram negative. Viruses are divided into two categories, DNA viruses and RNA viruses. We have seen yesterday the 6 DNA, the 15 RNA. The funguses are divided again in four categories based on the disease. Superficial mycosis causing superficial skin, then subcutaneous mycosis, then deep mycosis, and finally opportunistic. So 4, total 16 fungus just now I taught you. And now, lastly, I'm teaching you the parasito, complete. So the basis of the parasito, what is the basis of classification? Whether it is unicellular or multicellular. If it is unicellular, it is known as protozoa. And if it is multicellular, it is known as metazoa, also known as helminth. Metazoa or helminth, एक ही बात है. First learn that. Okay, got it. So can we go ahead? So learn the basis of classification of all the organisms. Let's continue with parasitology. So there are two types of parasites, protozoa, metazoa. Let's continue the classification. Protozoa is divided into 5 categories, 1, 2, 3, 4, 5. You have to learn the 5. And metazoa are divided into 3 categories, cystode, trematode, nematode. So total 5 plus 3, total 8 categories you have to learn. Okay, so protozoa की 5 categories क्या है? Let's start with protozoa. So what are the 5 categories of the protozoa? We have amoebas, amoebas. We have flagellates, sporozoans, ciliates, and microsporidia. What are amoebas? Amoebas are the organisms which have pseudopodia in them. These are amoebas. Flagellates are the organisms which have flagella in them. These are flagellates. Sporozoans are the organisms which have sporozoite in them. These are sporozoans. Ciliates are the organisms which have cilia in them. And microsporidia are not important. They have microspore inside them. Right? So just learn the 5 categories. What are the 5 categories? Say ma'am, amoeba, flagellate, sporozoan, ciliate, microsporidium. If you want to make some mnemonic, you can. If you can't make, just learn the names. These are the 5 categories of the protozoa. I'm teaching you protozoa. Let me further continue the classification. In this classification, I will teach you first 3 categories. ciliates and sporidia, microsporidia not in our syllabus. We will see first three only. The first three are important. So I will teach you amoebas, I will teach you flagellates, I will teach you sporozoans. Let me further classify. Chalo, start with amoeba. Start with amoeba. Start with amoeba. How many amoebas are there? See the three arrows. There are three type of amoebas. There are three type. You can continue उसी के नीचे. There are three type of amoebas. ठीक है? What are the three type of amoebas? What are the three type of amoebas? Pathogenic, non-pathogenic, free living. Please understand the meaning. There is only one amoeba in this world which cause disease in human. That is Entamoeba histolytica. I will start from this only today. Parasitology. So Entamoeba histolytica is the only amoeba which cause disease in human. That is pathogenic amoeba. Only one amoeba. These all are commensal. These are commensal. What are commensal? They do not cause harm to us. They remain in human body. They do not cause any harm. These are known as non-pathogenic. I will not teach you this. Just read their name, but I will not teach you because they do not cause any disease in us. Then why to study their details? But most of them are entamoeba only. Entamoeba coli, Entamoeba gingivalis, Entamoeba disper, Entamoeba hartmanni. This is also edoamoeba. So the suffix is amoeba, 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 amoeba. देख के तुम्हें समझ जाएगा amoeba. But one of it is not a suffix amoeba. Endolimax nana. You must understand कि Endolimax nana भी non-pathogenic है. बाकी तो amoeba, 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 amoeba suffix is there. ठीक है? These all are commensals. Just learn their names. Don't go in the detail. I will not give you the detail of any of them. Right? But there are three free living amoeba. You will say, what do you mean by three free living? They remain in the soil or water, in the environment. They don't have human as a natural host, but accidentally they enter in human. Accidentally. Galti se. These are usually free living, but accidentally they enter in human. Once they enter in human, no, they cause disease of the brain. These are known as neuroparasite, neuro eaters, brain eater, neuroparasite. Either say neuroparasite or say brain eater. These are known as brain eaters. So very important. The three. Which three? Naegleria floweri, Acantheba balmuthia. So can you see? The one is pathogenic. It causes disease in the intestine, and three of them causes disease in the brain. So total 4 amoebas I will teach you. The 4 amoebas. Can you see your page number 1 of the chart? Page number 1 of the chart. What are the 4 organisms? What is it written at the corner? In the corner, it may be written amoebas. I don't have it. I wish if I could show you. If I could show you. I don't have it. I'm sorry. I'm having chart of bacteria. ठीक है. So amoebas. Have you seen the 4 amoebas? Page number 1 पे मैंने क्या बना के दिया है? Entamoeba histolytica, the main one amoeba, and the 3 free living: Naegleria floweri, Acantheba, and Balmuthia, the Balmuthia medullus. Have you seen your chart? Everyone have opened the chart. Page number 1. Please open it. Open it right now. All of them are amoebas. It's written there. Yes, medico amoebas. So I will teach you in this sequence only. You can follow my chart. Okay, you can follow my chart. You can write down here in the chart only. This one is pathogenic, and these 3 are free living. These 3 are free living. They will cause disease in the brain. I will teach you the detail of them one by one. So 4 तो यहाँ से पढ़ने हैं, 5 minutes each, 5 or maybe 3 minutes on them. These are small. So we will require nearly, you can say, some minutes, on the amoebas. So amoebas हो जाएगा हमारा first. So after amoebas, we will come on the flagellates. The next we will come on the flagellates. How many flagellates are there? 3 type of flagellates. Depending human body में वो कहाँ रहते हैं? Where does they reside in human body? They reside in the intestine, they reside in the genital cavity, they reside in the blood of the human. Blood of the human is hemoflagellate. So one in the intestine, Giardia lamblia. I will teach you that. One in the genital, Trichomonas vaginalis. देखो नाम में ही है vaginalis. It is genital. It is genital because it is vaginalis. And third is the hemo. Hemo मतलब blood. Here we have 2, Leishmania, and there are 2 type of trypanosomes, Trypanosoma brucei and Trypanosoma cruzi. So total 5 are there. You can see one Giardia lamblia, 1 Trichomonas vaginalis, and 3 are there: Leishmania donovani, Trypanosoma brucei, and Trypanosoma cruzi. So I want you to open your page number 2 of the chart. These 2 are given. Say yes. If you get it, say yes. I'm telling you in the classification की बार-बार नहीं पढ़ाऊंगी. Whenever I move on Giardia lamblia, it's your choice कि आप page number 2 पे चले जाओ. तो बार-बार नहीं बोलूंगी अब ये page खोलो, ये page खोलो. I'm showing you कि where it is given. So whenever I give the detail, if you want to open, it's your choice. So these 2 are given on page number 2. Say yes. Giardia lamblia and Trichomonas vaginalis. Write down yes. You got the 2 here? Come on page number 3. Page number 3, you will get Trypanosoma brucei cruzi. Leishmania I have not given in the chart. I forgot to give. So if you wish, you can continue with these. Leishmania का chart में नहीं है. मैं गलती से भूल गई हूँ. I forgot to give. Ideally, I should give all 5 in the chart. So all 4 amoebas are in chart you will get. And out of the, so I have to teach you 4 amoebas and 5 flagellates. Here all 4 are given in the chart. Here out of 5, 4 are given in the chart. The 5th one you can continue in the chart if you wish. It's your choice, Annie. Okay, coming on the sporozoans. So we are coming. So 4 plus 5. है ना. कमिंग ऑन द स्पोरोजोन्स, देखिए हम यहाँ से कितने पढ़ने हैं. स्पोरोजोन्स. सो स्पोरोजोन्स, देयर आर मेनी स्पोरोजोन्स. देखो नाम में ही है स्पोरा, नाम में ही है स्पोरा, स्पोरा. सो ऑल द स्पोरा विल बी देयर, है ना. क्रिप्टोस्पोरा, साइक्लोस्पोरा, आइसोस्पोरा. स्पोरा स्पोरा स्पोरा. याद आया क्या? स्पोरास वर एसिड फास्ट ऑर्गेनिज्म, नो लॉन्गर सेपरेट बुकिंग रिम सिम कार्ड. उसमें स्पोरास आते हैं, द टू पैरासाइट्स, है ना. सो दीज आर द स्पोरास एंड दीज आर कमिंग इन द एक्सेप्शन. दे रिक्वायर 0.25% ऑफ H2SO4. याद आया क्या? स्पोरास है ना. उसके अलावा सैक्रोसिस्टिस है, टॉक्सोप्लाज्मा गोंडी है. द टू अल्ट्रा इंपॉर्टेंट दैट आई विल टीच यू इज प्लाज्मोडियम एंड बेविसिया. So I will teach you only two, Plasmodium and Babesia in detail. These just have a look in the classification. Question usually don't come from them. ठीक है, so we will not see the details. You can see your page number. What is the next page number? 1, 2, 3, 4. Page number 4 पे Plasmodium is given. The 4 types of Plasmodium is given. Plasmodium vivax, Plasmodium falciparum, Plasmodium ovale, Plasmodium malari. दिया है क्या 4 type of Plasmodium? So page number 4 पे all the Plasmodiums are there. Babesia is not there in the chart. It's very small. वो Plasmodium के नीचे ही ऐड कर देना आप, है ना. So this is, so that is the only thing. Ciliates में, coming on the next one, ciliates, है ना. So here I will teach you only two, Plasmodium and Babesia. I will teach you only two. So I will teach you 4 amoebas, I will teach you 5 flagellates, I will teach you 2 sporozoans. Ciliates में we have only one organism, Balantidium coli. Just learn, I will not teach you that. Just learn. यहाँ पे दो ही क्वेश्चन आते हैं. Number 1, these all are protozoa. These all are protozoa. What are protozoa, by the way? What is the difference between protozoa and metazoa? What is the difference between protozoa and metazoa? These are unicellular. Metazoa are multicellular. These are unicellular, no? These all are unicellulars. But ciliate is largest. Balantidium coli is largest among them. सबसे बड़ा. सब यूनिसेल्युलर है. वन सेल वन सेल वन सेल वन सेल. उनमें सबसे बड़ा कौन है? बैलेंटिडियम कोलाई, है ना. बैलेंटिडियम कोलाई, है ना. तो बैलेंटिडियम से बाला, इट्स अ बड़ा भाई. बी से बड़ा. आई लर्न लाइक दैट. बी से बड़ा, सबसे बड़ा है बैलेंटिडियम कोलाई. प्लीज लर्न. बी से बड़ा, यू विल नॉट फॉरगेट. ठीक है. Okay, so please learn. And the last one is microspora, microsporidia. It have only one organism, microsporidia. I will not teach you that. So basically, what I'm going to teach you, I'm going to teach you 4 amoebas. I'm going to teach you 5 flagellates. I'm going to teach you 2 sporozoans. I'm not going to teach you this. Just learn this is the largest one. That's it. And it is the only ciliated one. And here microsporidia is not important. So how many can you count? 5, 6, 7, 8, 9, 10, 11. 11. है ना. And 5 to 10 minutes on each. On an average 7 minutes on each. है ना. On an average 7 to 10 minutes भी ले लो तो we require 1.5 to 2 hours here, है ना, for completing protozoa. और इतना ही टाइम लगेगा मेटाजोआ में, है ना. मेटाजोआ में भी 11-12 हैं पढ़ाने की. So 11-12 यहाँ, 11-12 वहाँ, nearly 20-25 organisms I have to teach you. They all are there. This is the simplest way I can teach you. Okay जी, I'm giving you an orientation कि भाई पढ़ना कैसे है ना. So पहले इन सबसे दोस्ती करो, then we will see them one by one. So we have studied the protozoa. First, I have taught you parasitology. In the parasitology, there are 2 types of organisms, unicellular and multicellular. The unicellular are protozoa and the multicellular are metazoa, है ना. We divide the protozoa into 5 categories. Among them, हमारे काम की 3 ही है. The first 3 are important. The next 2 are not important, but you should know the names at least. And here total 3 categories are there, है ना. So here, what are the 5 categories in the protozoa? We will see it once. चलो, कौन बताएगा मुझे? Protozoa. Please write down. Write down the 5 categories. 1, 2, 3, 4, 5. Okay, I'm writing. The first are amoeba. The second is flagellate. The third is sporozoan. We will study only these 3. We will study only these 3. The fourth is ciliate. We will not study. The fifth is sporozoa. The fifth is microsporidia. Microsporidia, not important. We will not study this. It is not the thing I'm not teaching you. These are not in our syllabus. Just read the name. It is not given in books also, very, very detailed. Questions will not come from that. है ना. चलो. Amoebas में, let's divide it further. Amoebas में, tell me the 3 categories of the amoeba. Tell me who is pathogenic amoeba, who is non-pathogenic amoeba, and tell me who is free-living amoeba. So tell me, pathogenic amoeba is only one, Entamoeba histolytica. Non-pathogenic are many. You will learn your names at your end. I will not teach you those. Just learn the names. By option में आ गए तो you should be identified. ठीक है. And free-living में there are 3. Nigleria floweri. बोलो, Nigleria floweri. Entamoeba histolytica. And not Entamoeba histolytica. What I'm saying. Nigleria floweri. Acanthamoeba and Balmuthia. So you can learn the first letter. Entamoeba histolytica is EH, NF, A and B. You can learn like that. है ना? So these are the 4 amoebas I am going to teach you. Okay जी, है ना? Coming on the flagellates, चलो आ जाओ flagellates पे. Flagellates again we divide in 3 categories. What are the 3 categories of the flagellates? The one which reside in intestine, the one which reside in genital cavity, and the one which reside in the blood, that is hemoflagellate. So tell me the intestinal one, एक ही है, Giardia lamblia, Giardia lamblia, है ना. Genital में भी एक ही है, Trichomonas vaginalis, है ना. और हीमो में दो है, Leishmania donovani, I mean तीन है, Trypanosoma brucei, Trypanosoma cruzi, है ना. So total 5 I have to teach you. So we will see 4 from here, we will see 5 from here. You know the page number कहाँ पे क्या दिया है, you will follow that. ठीक है. Coming on the sporozoans, coming on the sporozoans. In the sporozoans there are many. You write all the sporas are there. है ना. Cryptospora, cyclospora, isospora. I will not teach you that. What I will teach you only two. Plasmodium and Babesia. Plasmodium and Babesia. So 2 from here we will study. So total 11 I am going to teach you. Here you can write Balanterium coli. This is the largest one. यही classification में ही लिख लो. This is the largest one and only ciliated. Ciliated में एक ही है. And Microsporidia is Microsporidia. है ना. No other question on that. So all of you are oriented कि what we are going to do in the next 1.5 hour. We are studying all these. है ना. First we will finish the amoebas. I will start with amoebas only. ठीक है जी. I will start with amoebas. So I will teach you 4 amoebas given on page number 1. Page number 1. I will teach you Entamoeba histolytica and the remaining 3. Naegleria floweri, Acanthamoeba balmothea. So I will teach you all 4. I guess सबके पास printout है. Printout is compulsory. Charts का तो compulsory है. Main notes का लो मत लो. But charts का printout तो compulsory है ना. चलो नहीं भी लिया है तो कोई बात नहीं. You can mark there. ठीक है. जहाँ पे भी तुम mark कर रहे हो. So that is amoebas. है ना. Flagellates में I am going to teach you 5 flagellates. है ना. Giardia lamblia, that is intestinal. Then Trichomonas vaginalis and the 3 hemoflagellates. Leishmania donovani, Trypanosoma brucei, cruzi. So these all are given on page number 2 and 3. जिस पर Leishmania वाला missing है. ठीक है. Sporozoans में I will teach you only 2. Plasmodium and Babesia. So it will take time. Some are very big. Some are very small. So on an average in the next 1.5 or 2 hour we are going to finish it. Protozoa. ठीक है. So this is all we have seen in the protozoa. Metazoa का classification में we divide them in 3 categories. Cystode, trematode, nematode. Cystodes, trematode, nematodes. So I'm not telling you this classification. Let me first finish protozoa. Then I will tell you the classification of metazoa. ठीक है. Otherwise you will get confused. Let me finish protozoa. The 11 organism. Let me teach you there. Let me finish 11. Then whenever we will start metazoa, first I will teach you the classification. These are the cystodes. है ना. Cystodes. There are 5 cystodes. I will teach you 1 trematode. I will teach you and 3 nematode. 5, 6, 7, 8, 9. 9 total I will teach you here. And these are big है ना. इनमें टाइम लगेगा. सब में 10-10 मिनट तो minimum 10 minutes. So it will require minimum 1.5 to 2 hours. So पूरा parasitology अच्छा खासा है. You got the orientation है ना. So these are the 5 cystodes I will teach you. There are many trematode but I will teach you only 1. And there are many nematode. I will teach you the 3 ultra important. This and this. The 3 ultra important. So this is the way we will carry out. Say yes. समझ में आया. फर्स्ट गेट ओरिएंटेड की पढ़ क्या रहे हैं है ना. ओरिएंटेशन ही नहीं होगा तो यू विल से मैम कोई भी ऑर्गेनिज्म उठा के कुछ भी पढ़ा रही है. यू शुड बी ओरिएंटेड कि व्हाट वी आर व्हाट सीक्वेंस वी आर गोइंग टू कंटिन्यू. ठीक है जी. ओके. सो वी हैव सीन द पैरासाइट्स. We have seen the classification of parasite. Before starting the parasite individually, you tell me what is host. You tell me what is host. Host क्या होता है? What is a host? Huh? What is a host? Host is an organism on which the parasite is residing and getting the 2 things, the nutrition and the shelter. And in बदले में the parasite is giving the disease to the host. वो तो हम सबको पता है. There are 2 type of host. Definitive host, also known as primary host, and also known as primary host, and intermediate host, also known as secondary host. So you must understand what is primary, what is secondary. I mean, what is definitive, what is intermediate before starting the chapter. Because I will use these terminology. You will say, "Ma'am, ये definitive host क्या होता है? ये intermediate host क्या होता है?" You got my point, huh? So first understand. Does anyone know what is definitive host and intermediate host? The definition is different for protozoa, and the definition is different for metazoa. Let me teach you the 4 definitions. Okay, let me teach you. So let me draw the 4 hosts. Let's assume host is a human. It can be animal also, है ना. ऐसा नहीं है कि host is always human. It can be animal also. So let me draw the 4. Just assume it is a human. So let me draw the 4 hosts for you. है ना. 2 for protozoa and 2 for metazoa. I will explain what is definitive, what is intermediate, what is definitive and what is intermediate. Okay. So this is for protozoa, the definitions. Protozoa. And this is for metazoa, the definitions. Metazoa or helminth. See, I will draw. If you wish, you can also draw. Listen. Inside the host, the parasite is there. So this is the parasite. This is the parasite. This is the parasite. This is the parasite. The parasite is inside the host. You all can see. Parasite is inside the host. Please understand. The parasite is inside the host. है ना? So the parasite inside the host is performing sexual cycle of its. It is a definitive host. It is known as definitive host. And if the parasite is performing asexual cycle, है ना? It is known as intermediate host. Say yes. These are the definitions for protozoa. Say yes, people. Say yes. हाँ बोलो. So what is the definitive host? It is the host inside which the parasite is performing sexual cycle. And what is intermediate host? It is a host inside which the parasite is performing a sexual cycle. Hannah ji, okay. Coming on the definitions in the metazoa. Here we don't have sexual asexual cycle like the protozoa. We don't have sexual asexual cycle. Here, who are metazoa? You say, ma'am, these are multicellular. ये तो unicellular थे ना protozoa. So they have sexual and asexual cycle. So that is how we define them, है ना? But these are multicellular. So here we have adult and larva. The adult यानी बड़ा and larva यानी बच्चा. Larva यानी small kid. So the host inside which the adult is there. So obviously adult will do the sexual cycle, na? Adult ही तो करेगा sexual. बच्चे थोड़ी larva don't do sexual cycle, na? Adults. The meaning is same. This is known as definitive host. And if the larva is there, obviously it's asexual cycle. Obviously. So it is known as intermediate host. I mean to say the meaning is same. Just correlate. I mean meaning is same. Adult only perform sexual cycle and larva only perform asexual. But you have to use these wordings. The wordings are this. So can you define the definitive and intermediate host for protozoa and metazoa? For protozoa, you define. What is the definitive host? You will say, ma'am, the definitive host is one inside which the parasite is performing sexual cycle. And what is the intermediate host? The intermediate host is one inside which the parasite is performing asexual cycle. Give me a thumbs up. You got it? What is the definition for metazoa or helminth? What is the definition for metazoa or helminth? A definitive host is one inside which the parasite is in adult form. And the intermediate host is one inside which the parasite is in larval form. Without any confusion, please learn it thoroughly. And don't get confused. Adult and larva cannot be in unicellular organism. अब भाई unicellular है तो क्या तो adult क्या तो larva. It is unicellular ना. So there is no adult and larva in unicellular. The adult and larva can be in multicellular. So that's why this definition will fit here. This definition will fit here. I'm trying to super simplify. Okay, G. So the same four definitions written in front of you. Chalo. Protozoa, metazoa. You can see. Definitive host, intermediate host. So who is the definitive host? Inside which? Sexual cycle. Intermediate host, asexual cycle. यहाँ पे definitive host in the helminth, the parasite is in adult form. And intermediate host, the parasite is in larval form. ठीक है ना? Read the question, tell me the answer. देखें किसे समझ में आया. Let's see who got it. चलो, tell me the answer, people, fast. Tell me the answer. Fast. So the host harboring adult or sexual cycle. Either adult or sexual, it's one and the same. If you say adult, it is for helminth. And if you say sexual, it is for protozoa. So both of them is definitive. Yes, both of them is definitive. Anna, yes. So tell me the next question. It's difficult. Don't rush. Definitive host in protozoa. Who is definitive host for protozoa? Not for metazoa. For protozoa. Who is the definitive host for protozoa? Yes, what's the correct answer? Who's the definitive host for protozoa? Host harboring adult or larva or sexual or asexual. Yes, very correct. Medico, very good. Manoj, everyone is correct. So correct answer is C. है ना? So it is, don't say A. कोई A तो नहीं बोल रहा है ना? Correct answer is C. If I change definitive to intermediate, what is your answer now? इसी क्वेश्चन में चेंज करेंगे. Definitive को intermediate में. Now what is your answer? What is your answer now? So for protozoa only I'm asking. But I'm asking intermediate. So now you said sexual, no? No, yes, you will say asexual in that case. Very good, Shivam, very good. Yes, so in that case, you will say asexual. The next question. Definitive host for helminth. Definitive host for helminth. Not for protozoa, I'm asking metazoa now. So metazoa ka definitive host kaun hai? The host harboring adult, larva, sexual ki asexual? For helminth, yes, obviously. Very correct, very correct. The correct answer is A. The correct answer is A. And again, if I change it to intermediate, the answer will become B. The answer will become B. So you got the 4 questions. ठीक है, चलो. The next thing, before starting the parasites, let me tell you one more thing. What is that? The life cycle of the parasites. So there are 2 types of life cycle in the parasites: direct, indirect. The direct also known as simple, indirect also known as complex. What do you mean by direct or simple, indirect or complex? Okay, listen. There are 2 types of life cycle. Life cycle की बात करके we will start the parasites now. One by one we will start as usual. है ना? Life cycle. There are 2 types of life cycle. Simple, also known as direct. One and the same thing. Simple or direct. And complex or indirect. Complex or indirect. है ना? Simple, complex, direct, indirect. What do you mean by that? Here total 2 hosts are there. ठीक है? I'm sorry. Only one host is there. Only one host. तो you will see, ma'am, जो one host है, वो definitive host है कि intermediate host है? So it is always definitive host. There is no intermediate host in them. So life cycle is simple. They have only one host, that is definitive. They don't have intermediate host. They can be protozoa, they can be metazoa. Say yes if you got it. They have only one host in the entire life cycle, and that too definite. They don't have intermediate host. That is the meaning of the simple life cycle. Say yes. And complex life cycle, they have either two hosts or they have three hosts. है ना, थ्री से ज्यादा नहीं होते, either two or three, है ना. So if they are two, so how many definitive, how many intermediate? If they are three, how many definitive, how many intermediate? You tell me that. You tell me that. Huh? You tell me. चलो बताओ. अगर it is two hosts, ना, so one is definitive, one is intermediate. It's like that, है ना. And if there are three hosts, definitive is always one, है ना. The remaining two will be intermediate. Can you see? Should I shift? It's behind me, no? Okay, you can see it like this. Okay, Ji, please learn. So total three. So write down if you wish, or just understand. So you will understand the life cycle, simple or complex. How many of you got it? Can we proceed? So listen. After this, the same thing is written. Here only we have one host, and that two definitive hosts. There is no intermediate host. Simple life cycle. And complex में two or more, two or three hosts are there. So here I have given the tables. Hana, I have given the tables to you. These tables, are they given in your notes or not given? I guess they are given. मैंने दिए तो होंगे print में. I guess they are given, no? Have I given these tables? Huh? Yes. So these tables I'm not reading now. This is for your last time revision. So in your tables, the definitive and intermediate host of all the parasites which I will teach you now. I will teach you 11 in the protozoa and nearly 8 or 9 in the metazoa. Total 19, 20 parasites I will teach you today. Hai. So all of them are enumerated here. Last time, just revise the definitive host and intermediate host in all of them. Just revise before going to your exam. Okay. Okay. So can we start the parasites now? Huh? Warm up ho gaya? This was just warm up. The race will start now. अभी तक तो warm up चल रहा था. We have just seen the classification. Huh? We have just done the friendship with all of them. Now we will see their detailed history of all of them. We know the names of all of them. One by one we will start. So are you people with me? Whatever notes you want to follow. Open the page number. I will not say keep page number this, that. I've told you I'm starting with amoebas. I'm going to teach you 4 amoebas. Hana, one by one I will teach you. Hana, 5-10 minutes on each of them. Let's start. So this is the classification of the amoebas. So first I will teach you amoebas, then flagellates, then sporozoan. These two I'm not going to teach you. Then I will shift on metazoa. So let's start amoebas. There are 3 types of amoebas: pathogenic, non-pathogenic, free living. Hana, pathogenic is only one, Entamoeba histolytica. So first I will teach you Entamoeba histolytica. These I will not teach you. And free living, the Naegleria floweri, Acanthamoeba, Balmuthia, I will teach you all 3. So total 4 amoebas. Let's start with the first one. This is a chart I have already given you. In your chart, this column is filled or empty? I don't know. I guess this is empty. If it is empty, you can draw with me. I have drawn, like I have given empty intentionally because in face-to-face classes, I asked the student to draw and show it to me. I know, that's why. If you wish, you can draw. Otherwise, it is given in the notes. Anyways, so let's start Entamoeba histolytica. Then I will move on Naegleria floweri, then Acanthamoeba, then Balmuthia. So let's start with the first one, Entamoeba histolytica. Whenever I start any parasite, the first thing I will teach you is the morphology. Without morphology, you cannot understand anything. The first thing you have to study morphology. है ना? Entamoeba histolytica. देखो एक parasites पढ़ो. I will teach you the first parasite. This is the first parasite I am teaching you now. Entamoeba histolytica. So you will have an overview that what is my way of teaching. In the same way, I will carry the remaining 19. I will teach you total 20 parasites. The remaining 19, I will teach you the same way. What's my point? है ना? So there is a peculiar way in which I teach all the parasites. It's very interesting. I will make parasitology a fun for you. Believe me. Give me 2-3 hours. I will make it. ठीक है, चलो. Entamoeba histolytica. There are 3 morphological forms. They remain either as trophozoite or as precyst or as cyst. है ना? Trophozoite, precyst, cyst. है ना? I maybe have given 3 columns, है ना, in your chart. Trophozoite, precyst, and cyst. You have to draw. You have to see the important things in the diagram, है ना? So trophozoite का shape क्या है? Say amoeba shape. Amoeba. Who is amoeba? Amoeba shape क्या होता है? The one who is having pseudopodia. Pseudopodia is the cytoplasmic extension. Whenever there is a cytoplasmic extension, whenever there is a pseudopodia, it is known as amoeba. So the shape is amoeba. Precyst का shape भी amoeba ही है. Precyst का shape भी amoeba है, but cyst is circular, spherical. I mean, the cyst is always spherical. So first see the shape. First I will draw with you. Let me explain. Then I will draw. You can also draw in your chart along with me. So first this is amoeba. This is amoeba. This is spherical. So the amoeba shape में you can see there are 2 cytoplasm, acto and endo. The 2 cytoplasm. The actocytoplasm is clear. Can you see bahar wala? The actocytoplasm is clear. The endocytoplasm is granular. Very unique. Acto is clear. You can see in the diagram very well. And endo is granular. Whenever there is an endo, there is a granular inside which the nucleus is present. Concentrate on the nucleus. This is nucleus. I know. Inside the nucleus, there is a dot at the center. Inside the nucleus, there is a dot-like structure at the center. This dot-like structure is known as karyosome. What it is known as? It is known as karyosome. The dot-like structure is known as karyosome. From the karyosome, the chromatin will be spoke-like arrangement. The chromatin will be like spoke-like arrangement. It look like wheel. So the nucleus is like a wheel. The nucleus is like a wheel. In the endocytoplasm, which is granular, can you see this is WBC, this is RBC. Oh my God, what is this WBC and RBC? This is a parasite WBC, RBC. No, this is a unicellular organism. इसमें circulatory system थोड़ी है, bone marrow थोड़ी है, it is having its own RBC, WBC. No, no, no. This RBC, WBC is of human. So this parasite is coming in human ka intestine and taking our blood. So it is the RBC and WBC of human. Very unique thing. So cytoplasm contain the RBC, the human RBC. It is known as erythrophagocytosis. Erythrophagocytosis. So ant amoeba histolytica perform erythrophagocytosis. Yes, it perform erythrophagocytosis. Got it? Please learn that. Say yes. So this is the this is the trophozoite. Priest is nothing important. It's like trophozoite only. But only thing it don't have RBCs inside that. The cyst, there are three type of cyst. Please see the three type of cyst. All of them are same. All of them are spherical. The only difference, this is uninucleate, one nucleus. This is binucleate and this is quadrinucleate. So हमारे काम का quadri है. Quadrinucleate is the mature cyst. Quadrinucleate cyst is the mature cyst. I am drawing all three. If you wish, you can draw with me. Trophozoite, precyst, and cyst. है ना? Just learn the important point. है ना? I guess in the charts now I have given the important points written in the diagrams. I have not drawn the diagram. I have given the space for the diagram. But what you have to show that labeling I have already given. I mean trophozoite, precyst, and cyst. I want you to draw a trophozoite which is amoeba shaped. You can draw any amoeba shaped. है ना? This is also amoeba shaped, having the pseudopodia, but this is spherical. I want you to draw. है ना? Here I want you to draw two cytoplasm, ecto and endo. I want you to draw a nucleus. है ना? Having a karyosome. Karyosome is at the center. Central. Highlight the word central karyosome. It is not eccentric. यहाँ पे central रहेगा. And spoke-like arrangement. है ना? In the endoplasm, I want you to draw few RBCs. Few RBCs and label it as erythrophagocytosis. है ना? So outer is clear, inner is granular. And erythrophagocytosis. How many of you got it? बस इतना सा दिखाना है. जो दिखाना है मैंने लिख के दिया है. This is nothing important. यहाँ पे draw 4 nucleus. Draw 4 nucleus. Write down quadrinucleate. Quadri मतलब 4. Quadrinucleate cyst. How many of you got it, people? Please keep talking with me. है ना? Got it? This is the morphology. ठीक है? So coming on mode of transmission. Coming on mode of transmission. How does it enter in human body? For all parasites, there can be various ways. Some parasites enter by eating. Eating is known as ingestion. Ingestion. Some enter via sexual route. है ना? Some enter via direct contact, direct skin contact. Some enter via swimming. है ना? So different parasites have different route. You have to tell me what is the route of the entry. What is the mode of the transmission. So here for ant amoeba histolytica, just a second. Here I'm sorry. Here for ant amoeba histolytica, it is ingestion. Ingestion. Can you see the person is eating? The person is eating the food or the drinking water which is contaminated with this parasite. So there are three forms now. Trophozoite, precyst, and cyst. Trophozoite, precyst, and cyst. So which of them is present in the food and it is going inside? So quadrinucleate cyst. Please learn the infective form is quadrinucleate. So food should contain the quadrinucleate cyst. If this food contain trophozoite or precyst, तो कुछ नहीं होगा. Trophozoite and precyst are not infective. The quadrinucleate cyst. So you have to learn the infective form. This is the meaning of the infective form. So this person is eating the food. The food is contaminated with quadrinucleate cyst. The food is contaminated with quadrinucleate cyst. Okay, Hannah. So let me draw the life cycle. Listen, you don't have to draw it. You have to understand only. Listen, let me draw a human for you. For all the 20 parasites, I will draw the life cycle like this. But you don't have to draw. You have to learn the summary. But if I tell you the summary directly, you will not understand. That's why drawing is important for me, not for you. Okay, just understand. Your point is understanding. Whatever you have to learn, I have given you. Okay. Okay, just a second. You can see this is the large intestine. Let me draw. Small intestine is done. This is the large intestine. Okay. Listen, this is a human. Can you see the girl who was eating? The same girl. She is eating, or any human is eating the food or the water contaminated with the quadrinucleate cyst. So see how beautifully I am drawing. The infective form is quadrinucleate cyst. यहाँ पे मुझे दो चीजें दिख रही हैं. What is the root? It's ingestion. What is the infective form? Quadrinucleate cyst. It's not trophozoite. It's not precyst. Please learn. So this cyst will go inside, 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 inside. In the stomach, it will rupture. In the stomach, excision occur. What it is known as excision. From one cyst, 4 trophozoite will come. 4 trophozoite. This is known as excision. From one cyst, 4 trophozoites will come. ठीक है? These trophozoites will move further. अब cyst तो हो गया convert. The trophozoites will move, and they will go in cecum. In cecum, they will stop. In cecum, they will stop. The trophozoites, they will stop in the cecum. Learn the word cecum. है ना? Now in cecum, they will invade. The mucosa have 4 layers, no? Intestine have 4 layers: mucosa, submucosa, muscularis propria, and serosa. So they will invade. They will invade in the wall and produce ulcer, flask-shaped ulcer. कौन सा shape ulcer? I will show you the diagram. Understand? Flask-shaped ulcer. So they will form the flask-shaped ulcer in the intestine. They will form the flask-shaped ulcer in the intestine. Say yes. Got it? Flask-shaped ulcer. The ulcer will bleed. The ulcer. So what are the symptoms? So patient have bleeding, patient have ulcer, patient have pain, patient have diarrhea and dysentery. Diarrhea be, dysentery be. So these are the symptoms. Say yes. Say yes. Not only this, यहाँ पे रुकेगी नहीं कहानी. The story अभी बाकी है. Now from intestine, the blood vessel goes the portal vein. So this is the portal vein. The portal vein goes to the liver. So these trophozoite, again I say trophozoite, not cyst. आपको highlight करना है, trophozoite is सब कर रहा है, cyst कुछ नहीं कर रहा. Cyst is entering and trophozoite is causing everything. The trophozoite will go to the portal vein. Cyst will not go to the portal vein. Trophozoite will go to the portal vein. It will go in the liver. In the liver, it will produce the abscess. It will produce the abscess in the liver. The abscess contains the brown pus. So if you cut it, the brown pus will come. The brown pus look like the sauce. Tomato sauce देखा है? The brown sauce is known as anchovy sauce. Anchovy. It is known as anchovy sauce abscess. Say yes. Say yes. So this is how you have to learn. From the liver, story is not over. They will continue their journey. They will go to IVC, inferior vena cava, और वहां से चले जाएंगे heart में, है ना? Right side of the heart, and after that, after purification in the lung, they will go in the left side. So the third organ involved is the lung. They will produce an abscess in the lung also. They will produce in the abscess. So what diseases they, and after that through aorta they can cause multiple organ involvement. लेकिन वो बहुत rare है. So tell me the diseases. चलो, I'm highlighting. So no, the first disease in the intestine, it is known as intestinal amoebiasis. Say yes. The second disease in the liver, it is known as extraintestinal amoebiasis. Say yes. Extraintestinal amoebiasis occurs in liver. Say the word extraintestinal amoebiasis. It occurs in liver. Or extrahepatic amoebiasis occurs in the lung. So say the 3 diseases. Naam bolo. Say ma'am, intestinal amoebiasis. है ना? Say ma'am, extraintestinal amoebiasis. It occurs in liver. है ना? And extrahepatic amoebiasis. तीनों amoebiasis हैं. It occurs in lung. So learn the 3 organs. Say yes, people. Say yes. लंग तक बहुत रेयर पहुंचता है, उससे पहले ट्रीटमेंट हो जाता है ना? और आफ्टर दैट मल्टीपल ऑर्गन्स कैन बी इन्वॉल्व. Say yes. So these are the symptoms. Tell me the symptoms of intestinal amoebiasis. What the patient present? You will see patient have pain, patient have diarrhea, patient have dysentery, patient have flask-shaped ulcer, and that's it. This is the symptom. No need to learn. समझ में आ रहा है? These are the symptoms. Tell me the symptoms of extrahepatic. You will see ma'am hepatomegaly. Right side में hepatomegaly is there. है ना? And patient have pain in the right hypochondrium. है ना? Right abdomen में. Patient have pain, hepatomegaly. है ना? And brown color pus. स्पेशली ऑन द राइट लोब ऑफ द लिवर. राइट लोब में ये ज्यादा होता है ना? राइट लोब के पोस्टीरियर सुपीरियर सरफेस पे. ठीक है? एंड लंग वाले में ओनली एब्सेस इज देयर. पेशेंट हैव डिस्निया वगैरह, ब्रीथलेसनेस. सो सिम्टम्स नो नीड टू लर्न. हमें समझ में आ रहा है. लर्न द नेम ऑफ द डिजीजेस. सो लर्न द 3 डिजीजेस, लर्न द सिम्टम्स, आई मीन अंडरस्टैंड द सिम्टम्स, है ना? एंड you tell me this patient is coming to your clinic. ठीक है? Doctor, I'm having pain in my abdomen, I'm having diarrhea, I'm having dysentery, and you are having high, and I'm having pain in the right abdomen also. So you have a high suspicion that this patient is having Entamoeba histolytica infection. So tell me the specimen. पहले तो specimen बताओ. क्या specimen लोगे? First tell me specimen, then I will ask the test. चलो जल्दी बताओ यार. What do you take the specimen? Specimen क्या लोगे? What do you take the specimen? अगर disease is intestinal, तो specimen is stool. यहाँ पे हम stool ले लेंगे. Stool for intestinal amoebiasis. But for extraintestinal, the liver वाला, उसके लिए liver से aspirate करना पड़ेगा. Liver aspirate. The aspirate from the liver will be my specimen. So we will do the sonography, and by doing sonography, guided aspirate we will do. Say yes, people. Lung तक तो पहुंचता ही नहीं है. Lung में भी है तो we will do aspirate, लेकिन मैं lung की बात नहीं करूंगी. I'm considering only 2. Intestinal amoebiasis and extraintestinal. तो यहाँ पे stool में क्या मिलेगा? Let me give you 3 options. Only trophozoite, only cyst or both. बताओ stool में क्या मिलेगा? कॉमन सेंस. देखो ना डायग्राम में स्टूल में क्या मिलेगा? से ललित, मेडिको, सद्दाम, हु एल्स, एलिजाबेथ, कोई तो बताओ. एनीवन? बोथ. वेरी गुड मेडिको, बोथ. सो इन द स्टूल यू गेट बोथ. ट्रोफोजॉइड तो आएंगे ही आएंगे, लेकिन सिस्ट आर आल्सो देयर ना. मे बी सम सिस्ट आर नॉट रप्चर्ड एंड दे कैन कम इन द स्टूल. सो यू विल गेट बोथ. लर्न स्टूल कंटेन बोथ. stool contain both. No, Lalit, stool contain both. Maybe some cysts are also coming, है ना? But what do you get in the liver aspirate? The same three option. Only trophozoite, only cyst or both. Liver aspirate में क्या मिलेगा? Liver aspirate में. So only trophozoite are crossing the portal vein. Cysts don't cross the portal vein. So only trophozoite are present in the liver aspirate, not the cyst. So please understand. We take stool sample, we take liver aspirate. We take stool sample for intestinal amoebiasis, and we take liver aspirate for the extraintestinal amoebiasis. Here we get both trophozoite and cyst, and here we get only trophozoite. No need to learn anything. Everything is understandable. So इसी diagram में देखो अब questions क्या क्या आते हैं. I'm asking 20 questions on the life cycle. 20 question पूछूंगी मैं. You tell me 20 answers. है ना? पूरे questions we will cover in this diagram. You can understand everything. अब पूरा chart पढ़ लो. You got everything in this cycle. चलो. You will tell me what is the mode of transmission. You will say, ma'am, ingestion, khana, ingestion, number 1. Number 2, what is the infective form? You say, ma'am, quadrinucleate cyst. ठीक है? Number 2 question. Number 3, excitation occurs where? Say, ma'am, stomach. Number 3. Number 4, the trophozoite cause ulcers in which organ? Answer is cecum. Answer is cecum. One trophozoite rupture into how many trophozoites? One cyst rupture into 4 trophozoite. 5th question. है ना? After that, what are the diseases? है ना? Here we have intestinal. Here we have extraintestinal, then extrahepatic. In the intestinal one, flask-shaped ulcers are typical. Diarrhea, dysentery. है ना? And here anchovy, brown color sauce abscess in the right lobe of the liver producing hepatomegaly are the symptoms. है ना? Diagnosis में stool में present both. Liver aspirate में only trophozoite. Lung aspirate में only trophozoite. ठीक है जी? Can we go? Drug of choice. पढ़ लो. खत्म हो गई बात. है ना? Read your chart completely. कोई ऐसी चीज जो मैंने नहीं बताई चार्ट में लिखी है? Something like written in your chart and I have not taught you, read your chart. I'm giving you time. Okay, before that, have a look on my PPT. Have a look. So what is the mode of transmission? Say, ma'am, ingestion. What is the infective form? Say, quadrinucleate cyst. Acha, puri life cycle is completed in one host, man. There is no intermediate host. Only one host, man. है ना? क्योंकि पूरी life cycle में we got only man. There is no other animal. There is no other vector. There is nothing. So write down man. है ना? So instead of drawing this circle, better, how I told you, na, drawing a human is better. है ना? You can appreciate the flask-shaped ulcer. It's an image-based question. Images देखो. Appreciate the flask here. Appreciate the flask here. Appreciate the flask here. Appreciate the. These all are flask. Appreciate the 4 layer: mucosa, submucosa, musculus propria, and serosa. Appreciate the flask. Say yes. Appreciate the flask. The same. Appreciate the flask. Say yes. Appreciate the layers. Flask-shaped ulcer. मटके के shape का ulcer होगा. Flask-shaped ulcer. Very unique feature. Very unique. So till now we have 3 type of ulcers. चलो revise करेंगे. You tell me longitudinal ulcers कहाँ होते हैं? You tell me transverse ulcers कहाँ होते हैं? And you tell me flask shape ulcers कहाँ होते हैं? तीनों PYQ हैं जी, तीनों. चलो बताओ, कौन बताएगा? Flask shape, just now I told you, entamoeba histolytica. Flask shape ulcer. Longitudinal like a typhoid याद आता है मुझे long से. Typhoid, है ना? And transverse is tube यानी TB. है ना? So transverse is TB. So all three are PYQ. Please learn it. है ना? तो flask shape ulcers बताएं, है ना? चलो diseases intestinal, extraintestinal. Intestinal में dysentery होगा and extraintestinal में liver involved होगा. See anchovy sauce abscess. Appreciate the brown color pus. This is anchovy sauce abscess. Anchovy sauce abscess. है ना? We are done. Okay. Anything which is given in your chart and not taught you, or anything which is given in the notes? So we are done with the first parasite. In the same way, we are continuing with 19 more. Okay, got it. Anyone want any change in the method of teaching? You can follow the same method. Chalo. Read the question, tell me the answer. Which of the following is true for the trophozoite of entamoeba histolytica? Which of the following is true? Okay. Which of the following is true? It is having an eccentric karyosome, yes or no? Outer cytoplasm, outer ectocytoplasm is granular, yes or no? It shows erythrophagocytosis, yes or no? Or the bacteria are present inside the cell, yes or no? Which of the following is true? People, fast. Jaldi batao thoda. Very good, very good. It is showing erythrophagocytosis. The karyosome is there, but it is not eccentric, it is central. Ectoplasm is there, outer cytoplasm, but it is clear, not granular. है ना? And bacteria are not present. Erythrophagocytosis is a unique feature, RBC in the parasite. So that is very unique and that is correct. So correct answer is C. है ना? Read the question. है ना? Question पढ़ के करना है. Answer मुझे भी पता है. There is a 23-year-old man presented with abdominal pain. पहला clue है abdominal pain. Bloody diarrhea. दूसरा clue है dysentery. Dysentery is always the clue. है ना? 1 week duration. See the following diagram. See the biopsy. Tell me the diagnosis. The biopsy is unique. The biopsy is typically showing, see the margin of the ulcer. It is typically showing tarsal ulcer, it's amoebiasis. So correct answer is amoebiasis. Okay, G. Correct answer is amoebiasis. Okay, G. है ना? So we are done with erythro and amoeba histolytica. Can I start the next three? Can I start the next three? All of them are free living amoebas. I'm starting with Naegleria floweri. Then Acanthamoeba, then Bagnmuthia. They're very small, hardly 2 minutes. बहुत छोटे छोटे से हैं. All of them are free living amoebas. मेरी बात सुनो. They all cause CNS infection. ठीक है? They all are brain eaters. ठीक है? They all are neuroparasites. They all are free living, accidentally enter in human body. Let's start with Naegleria. Let's start with Naegleria floweri. Naegleria floweri. It is having only two forms, trophozoite and cyst. No precyst. It is having trophozoite number 1. It is having cyst number 2. Trophozoite is of two type. One trophozoite is having pseudopodia, that is amoebic, है ना, क्योंकि amoeba shape का है. You can see it is amoeba shape. And one is having flagella. It is known as flagellate. So two type of trophozoite. Amoebic trophozoite and flagellate trophozoite, है ना? That you have to learn. That's it. और कुछ नहीं. और cyst is there. Cyst में nucleus याद करनी है. हमेशा cyst में just learn the number of the nucleus. Say it's uninucleate. Say it's uninucleate, है ना? So please draw Naegleria floweri wherever in your chart now. I may have given you the space. So draw the 3 diagram. Draw the trophozoite. Draw the cyst. Draw the 2 type of trophozoite, amoeboid and flagellate. And draw one cyst. I want you to draw with me. Amoeboid you can draw any shape. It should be amoeba, है ना? Flagellate में it should have the flagella, है ना? और cyst में it should be uninucleate. That's it. इतनी सी तो बनानी है चीज, है ना? बाकी सब काम का नहीं है, जो काम का है उस पे ध्यान दो. The point is that it is having a flagellated cyst. Flagella की वजह से आती है motility. So the cyst, the trophozoite is motile. The trophozoite is motile. Write down motile. Flagellated trophozoite की वजह से write down motile word there. I want you to highlight the word motile trophozoite. So this one is having a motile trophozoite because the trophozoite is having flagella. Say yes. Lalit, Elizabeth, Saddam, Hani, Sasika, you got it? Everyone, can we go? So please highlight the word. Write down the word motile. Mode of transmission is very unique. It enters in human body via swimming. It enters in human body via swimming. Hannah, do you swim? Swimming in the fresh water, not in the sea, not in marine water. Swimming in fresh water can be pond, lake, swimming pool, anywhere. Hannah, but it should be fresh water body. It should not be sea. It should not be marine. Hannah, it is not there in sea or marine. Salty water. It is in fresh water. Okay? So that is the swimming. Via swimming, it enters via nose. So whenever we swim, it enters via nose. Who is the infective form? The amoeboid form of the trophozoite. It's trophozoite, not cyst. वहाँ पे cyst था, यहाँ trophozoite है. So see here, the trophozoite is entering inside the nose. Imagine, the water contains the trophozoite, and the trophozoite is entering from the nose. From the nose, it will go to the nasal mucosa. From the nasal mucosa, it will go to the cribriform plate. From the cribriform plate, it will go to olfactory nerve, and via olfactory nerve, it reaches the brain. It reaches the brain. Say yes. So first nose, है ना? First nose, it enters from nose. Nose के बाद cribriform plate. Cribriform plate के बाद olfactory nerve, and olfactory nerve से ये पहुंच जाएगा brain में. So this is the route from here to here. It's like this. Listen. Let me tell you something. I don't know whether you know or not. This is the brain. And our brain. In the brain, we have 3 meninges. You may be knowing pia meter is the innermost, then arachnoid, then dura meter. So in the brain, there are 2 things. If the brain ka inflammation, it is known as encephalitis. Encephalitis. And if the meninges ka inflammation, it is known as meningitis. Meningitis. In the brain, there are 2 types of inflammation. This causes both. Currently, I am interested for Naegleria floweri. So Naegleria floweri causes meningitis as well as encephalitis. Got my point? So it causes meningoencephalitis. What does it causes? Meningoencephalitis. So it causes a disease which is known as, isko PAME kar dena. It causes a disease known as PAME, primary amoebic meningoencephalitis. I want you to highlight meningitis as well as encephalitis. I want you to highlight it. It will give you a clue to you in the question. Meningoencephalitis. दोनों चीज करता है ना? Primary amoebic meningoencephalitis. है ना? Patient have seizures, patient have coma, patient have death. No treatment available. Okay, ji? है ना? So that is the thing. That is the thing. Okay, read your chart. Anything additional is given. So read your chart. Tell me the morphological form. You will know. So Naegleria floweri we have completed. So tell me the morphological form. 2 form बताना है तुम्हें morphology में. One is trophozoite, one is cyst. लेकिन trophozoite is of 2 type. So ये हुई morphology. Tell me the mode of transmission. है ना? Tell me life cycle में host कितने हैं? है ना? Only definitive host is man. No intermediate host. So tell me the disease. इतना ही तो बताना है. और क्या बताना है ना? So you know everything. So ये trophozoite are of 2 type. ठीक है? One is amoebic and one is flagellate. Flagellate की वजह से motility है ना? Cyst is uninucleate, है ना? Mode of transmission is swimming. स्विमिंग, और स्विमिंग में इन्फेक्टिव फॉर्म क्या है, इन्फेक्टिव फॉर्म भी बताना है. इट इज नॉट cyst like the previous one, it was eating cyst. Here it's trophozoite. Host is only man, no animal host. और disease में only one disease, PAME. What is the full form of PAME? हाँ, primary amoebic, वो तो ठीक है. Meningoencephalitis is me. Meningoencephalitis. Say yes people, say yes. कुछ है एक्स्ट्रा चार्ट में कि आगे बढ़ूं? एटलीस्ट फ्यू पीपल बी इंटरेक्टिव. जल्दी जल्दी बताओ. कैन आई मूव? देख लिया चार्ट में. चलो, द नेक्स्ट इज एकेंथमीबा. हम तीनों के क्वेश्चन साथ में देखेंगे. एकेंथमीबा एंड बालमुतिया आर एग्जैक्टली सेम. ठीक है. एकेंथमीबा, एकेंथमीबा में वी हैव ओनली टू फॉर्म, ट्रोफोजोइट एंड सिस्ट. ठीक है. ट्रोफोजोइट इज नॉट ब्रांचिंग. ट्रोफोजोइट में भी ना ये साइटोप्लाज्मिक एक्सटेंशन होते हैं, लेकिन इट इज नोन एज एकेंथोपोडिया. इट इज नॉट सूडोपोडिया, इट इज एकेंथोपोडिया, है ना. और सिस्ट इज यूनिन्यूक्लिएट. कुछ खास नहीं है मतलब, है ना. ठीक है. मोड ऑफ ट्रांसमिशन इज इनहेलेशन. इट इज प्रेजेंट इन द डस्ट, है ना. तो ट्रोफोजोइट इज प्रेजेंट इन द डस्ट. So trophozoite present in the dust go inside. It will go in the nose, it will go in the trachea, it will go in the bronchi, it will go in the lung. From the lung it will go in the blood. It will go in the blood. From the blood it will go in the brain. In the brain it involve only encephalitis, no meningitis. Only encephalitis, no meningitis. Mind my word. That was causing both. This one causing only encephalitis. That was entering via swimming from the nose. This is via inhalation via dust, है ना. So route is entirely different. वहां पे भी एक ही host man, यहाँ पे भी एक ही host man. Say yes. So inhalation of the dust, it will go to the lung, है ना. From the lung to the blood, from the blood to the brain, है ना. Brain में it causes encephalitis, only encephalitis, no meningitis. In the brain, multiple granulomas are formed like the TB. Multiple granulomas. It is known as granulomatic amoebic encephalitis. You can learn GAI, granulomatous amoebic encephalitis. ठीक है. From the blood, it is going to the brain also and eyes also. In the eyes, it causes keratitis. In the eyes, it is going in the eyes also. From the blood to brain and eye. So brain and eye both are involved. Brain and eye both are involved. Okay, got it, Hana? So that is the thing. The next is Balmuthia. Balmuthia is exactly same. Exactly same. The trophozoite is branching. You can see its branches are there. Branching. Write the word branching. Trophozoite is branching. Cyst is uninucleate. Cyst is uninucleate, Hana? And the exactly same life cycle as that of acanthmeba. It also enters via inhalation, है ना. Like this only. This is same. This is same for Balmuthia and acanthmeba. दोनों के लिए same है. Say yes. Say yes. So ultimately you have to learn it. Ultimately you have to learn it and you have to tell me the answers. ठीक है. चलो पूरे answers बताओगे. The 4 parasites are done. 20 में से 4 हो गए. Congratulations. ठीक है. You will tell me. So first you tell me Entamoeba histolytica, then Naegleria floweri, then acanthmeba and Balmuthia. ठीक है. Entamoeba histolytica, Naegleria floweri, acanthmeba and Balmuthia. Whatever headings given to you, that's what I am writing only, है ना. Without looking at your charts, बिना देखे मुझे बताओ सब. So first आपको मुझे सबका morphological forms बनवाने हैं. You have to help me to draw the diagrams here. Morphology. Then you have to tell me the mode of transmission. Then you have to tell me the infective form. Then you have to tell me the host. Life cycle में सिर्फ host याद करना है. Who's asking? Medico. सिर्फ host याद करना है. पूरी life cycle नहीं करना है. Definitive host कौन है? इंटरमीडिएट कौन है. आई एम टेलिंग यू द लाइफ साइकिल सो दैट यू कैन लर्न. मैं डायरेक्टली बता दूंगी तो कुछ नहीं समझेगा, बट नाउ यू कैन लर्न, है ना. एंड यू हैव टू टेल मी द डिजीज, है ना. एंड डायग्नोसिस जहां इंपॉर्टेंट है सिर्फ वही बताना है. चलो, हु विल हेल्प मी? पैरेलल भरेंगे. हु विल हेल्प मी? हाँ, चलो. यहाँ पे वी हैव ट्रोफोजोइट, प्रीसिस्ट एंड सिस्ट. ठीक है. यहाँ वी हैव ओनली ट्रोफोजोइट एंड सिस्ट. Only trophozoite and cyst. Only trophozoite and cyst. We don't have precyst anywhere else. I'm trying to draw. यहाँ का trophozoite is amoeba shape, having ectoplasm, having endoplasm, having a wheel-like nucleus, having RBC in the endoplasm, erythrophagocytosis. Whatever important मैं सिर्फ वो दिखाऊंगी डायग्राम में. मुझे पूरा नीट एंड क्लीन डायग्राम नहीं बनाना है 5 मार्क्स का लेबल्ड. मुझे सिर्फ आइडेंटिफाई करना है. प्रीसिस्ट इज सेम, है ना. सिस्ट इज क्वाड्रीन्यूक्लिएट. 1 2 3 4. ठीक है. Here we have 2 type of trophozoite you can draw, है ना. ये है आपका amoeba shape और ये है flagella, flagellated, and cyst is uninucleate. ठीक है. Here we have acanthopodia. ठीक है. And here we have branching. Branching is there. Branching. Trophozoite में. Cyst is uninucleate, cyst is uninucleate. This is what I am expecting you to draw or you to learn or whatever. I want you to keep it in mind so that image-based question come, you can identify. Say yes. Everyone say yes. Tell me the mode of transmission. चलो. Entamoeba histolytica eating, ingestion. ठीक है. Naegleria floweri, swimming. Via swimming it enters. And the remaining 2, acanthmeba and Balmuthia, inhalation and inhalation. ओके हाँ जी, कंपेयर इन योर चार्ट्स, ठीक है। इनफैक्टिव फॉर्म बोलो मुझे सबका, इज इट ट्रोफोजॉइट और ट्रीसिस्ट और सिस्ट? से मैम इट्स सिस्ट, rather it's quadrinucleate cyst, to be specific, to be specific, to be specific. Here it's trophozoite, trophozoite, trophozoite. Compare. Here it is cyst, the remaining three are trophozoite. Okay ji, है ना? Host in all of them, host is only one, man. The definitive host is man, 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 man. There is no intermediate host in any of them. So all of them have simple life cycle, direct life cycle, not complex, not complex. ठीक है जी, चलिए डिजीजेस बताइए सबकी। यहाँ पे we have two diseases, intestinal amoebiasis, extra intestinal amoebiasis और extra hepatic भी होती है, ठीक है। You know ये the symptoms here, flash shape ulcers हैं, abdominal pain, diarrhea, dysentery, यहाँ पे एनकोविसॉस, ठीक है, you know the symptoms। यहाँ पे डिजीज है पामे, यहाँ पे डिजीज है गाई, और यहाँ पे डिजीज है गाई, लेकिन यहाँ पे गाई के साथ किरेटाइटिस भी है, आई भी इन्वॉल्व होगी, बाकी तीनों में ओनली ब्रेन है। से द फुल फॉर्म पीपल, पामे में मैनिंगो इनकेफेलाइटिस है, सो मैनिंजाइटिस इनकेफेलाइटिस बोथ, दैट यू हैव टू हाईलाइट। यहाँ पे ओनली इनकेफेलाइटिस, ठीक है। प्राइमरी अमीबिक मैनिंगो इनकेफेलाइटिस, ग्रेनुलर अमीबिक, ग्रेनुलोमेटस अमीबिक इनकेफेलाइटिस, ग्रेनुलोमेटस अमीबिक इनकेफेलाइटिस, यहाँ पे किरेटाइटिस भी है, ठीक है। सैंपल बोलो, डायग्नोसिस के लिए सैंपल बोलो। सो हियर फॉर इंटेस्टाइनल अमीबियासिस वी टेक स्टूल, एंड फॉर एक्स्ट्रा इंटेस्टाइनल वी टेक द लीवर एस्पिरेट, liver abscess aspirate. Here we take CSF, here we take CSF, here we take CSF. And now with your brain you just apply in which specimen you will get trophozoite, you will get cyst, जो भी मिलेगा। समझ में आई के बाद चलो बता देती हूँ, ठीक है। स्टूल में you get both trophozoite and cyst, liver aspirate में you get only trophozoite, है ना। And here you get only trophozoite, only trophozoite, only trophozoite. In the CSF you get trophozoites. ओके जी, खत्म करें कहानी, सब थम्स अप दो, जितने ऑडियंस लाइव है गिव मी अ थम्स अप, or write down that you got it, or write down something that I can know that this is your gesture and you got it. Shall I proceed? 4 are done. Ultimately you have to learn this, don't learn the life cycle completely, learn the table, whatever I have given you 100% question will be from this, that is my guarantee. But if I teach you only the tables na, it will be done in 1 hour, 1 घंटे में क्लास खत्म, मेरी भी छुट्टी तुम्हारी भी, but you will not मतलब understand anything. So this is why we have to go in the detail, but ultimately learn तो इतना ही करना है. I'm telling you the details so that you can retain, but don't learn extra anything. Okay ji, you got the way, ठीक है। No, it is not seen in Balmuthia keratitis, is seen only in acanthamoeba. Whatever written is absolutely true. Okay, okay ji, okay Gokul, you are asking constantly for the break, why don't you have a cup of tea? Okay, listen, okay, I will give you the break. Let's solve 2-3 questions on this and let's take a break. Chalo, there is a 30-year-old patient having features of meningoencephalitis. Take the clue. Meningoencephalitis, both meningitis, encephalitis. CSF show a motile unicellular organism. I'm having 2 clues here. What is the answer? Medical answer is A. Yes, why not B? My point is why not B? Why not B? There are 2 clues because this one causes both meningoencephalitis, this causes only encephalitis. है ना? And here the trophozoite is motile because it is having flagellated trophozoite. Here the trophozoite is non-motile. So in that question we have 2 clues. Number 1 meningoencephalitis both, and number 2 the motile organism भी तो सबसे बड़ा clue है ना? Got it my point? Yes, that is causing guy. That is first clue, है ना? And motile is also a clue. Everyone got it? Coming to the next question. Which of the following is true for Naegleria floweri? Is it living in the fresh water, hot spring, salty water or desert? कहाँ रहता है Naegleria floweri? Swimming से आता है कौन सा water? Fresh water. I told you it's fresh water, है ना? It's fresh water swimming. Please learn the fresh water. ठीक है? Yes. So let's take a break, and after the break I will start with the flagellates. I want you full energy. Break इसलिए लेट देती हूँ कि energy खत्म हो जाती है तुम्हारी break के बाद. Energy उतनी ही चाहिए, है ना? If you are expecting my energy to be this level, ठीक है? You have to be same. So flagellates, I have to teach you 5 flagellates, 5 minutes on each. So maybe 30 minutes लगेंगे flagellates को complete करने में. 30-35 minutes. Questions भी होते हैं ना फिर, ठीक है? So amoebas are done, है ना? Flagellates, and here also we require 30 minutes. Plasmodium is very big, 30. So next 1 hour में we are going to complete protozoa, ठीक है? And then we will take a coffee break, and then we will start the metazoa, the last session, ठीक है? चलो जी, है ना? So let's take a break. I will have my lunch also during this break. So it's 12:25 right now. So let's start at 1:40 directly, because it is a lunch break also. I'm not going to give any break after that. Maybe at 4 o'clock we will take a small coffee break, or whenever I feel drowsy after that. So 1:40 is good to go. Huh? 1:40, huh? Or let's start at 1:45, quarter to 2, 1:45. ठीक है? Break. ठीक है? Lunch break. Have your lunch. Don't expect कि एक और break मिलेगा lunch के लिए. This is the lunch break only. Okay जी, bye. So 1:45.